Day. The Committee on Health, Tourism, Historic Preservation, Land and Justice is now called to order. Today is November 10th, 2020. The time is 1:07 p.m. Notices for this virtual public hearing were disseminated via email to all senators and all main media broadcasting outlets on Tuesday, November 3rd, 2020, and again on Sunday, November 8th, 2020. The notice was also published in the Guam Daily Post on the same days. This Zoom meeting is hosted by the legislature's MIS staff, and I thank them for their assistance. The host of this hearing will mute all Zoom participants until called upon by the chair. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. If you're from a government agency, please state your title as well. When called to speak, of course, please make sure that you are unmuted. All right, so we have 5 agenda items for today, and we've slightly rearranged the orders, but the bills will be heard in this order. Bill 387 is an act to add a new Article 3A of Chapter 19, Title 10, Guam Code Annotated, relative to creating a digital contact tracing program for illnesses during a public health emergency. And then we will hear Bill 301, which is an act to add a new Article 9 to Chapter 77, Division 2, Title 12, Guam Code Annotated, relative to authorizing certain tax credits for required medical equipment and electronic health record systems for the Guam Memorial Hospital Authority. Bill 305, an act to add Chapter 98, Division 4 of Title 10, Guam Code Annotated, relative to a public-private partnership for the management of the Guam Memorial Hospital. And then we will hear Bill 303, an act to add a new 3707 to Article 7, Chapter 3, Title 10, Guam Code Annotated, relative to creating the Guam Medicaid State Plan Advisory Council. And then Bill 414, which is an act to amend sections 19104, 19202A, 19804B, and to add sections 19403B, 6, and 7, all of Chapter 19 of Division 1 of Title 10, Guam Code Annotated, relative to establishing limited liability to essential businesses and private and public sector entities under the Emergency Health Powers Act during a public health emergency. All right, I'd like to acknowledge my colleagues who are present. Thank you, colleagues, for being present. Beginning with Senator Jose Peter Terlaje, Minority Leader Senator Terlaje, Senator Luis Muña, Legislative Secretary Senator Amanda Shelton, Senator James Moylan, Senator Will Castro, and Senator Clint Rigel. And Speaker Tina Muña Barnes. All right, so we'll begin with Bill 387. This bill is introduced by Senator Clint Rigel, Jose Peter Terlaje, Tina Muña Barnes, Will Castro. An act to add a new Article 3A of Chapter 19, Title 10, Guam Code Annotated, relative to creating a digital contact tracing program for illnesses during a public health emergency. Before we hear from those who've signed up to testify, I would like to ask the sponsor of the bill, Senator Rigel, to introduce the bill, please.
Thank you, Chairwoman Terlaje. Bill 387-35 amends the public health emergency law to allow digital contact tracing for island residents to supplement the current contact tracing for COVID-19 and future diseases that may warrant a public health emergency. Now, this bill was introduced a while ago, actually before public health implemented a form of digital contact tracing app. And so my hope is that although you guys have already rolled out a digital contact tracing app, I'm hoping that maybe through hearing this bill, we can find out if there's anything else that this bill could add to assist you guys with the implementation of digital contact tracing, or if the bill's necessary still at this point in time. But I'd definitely like to still hear from all of you, and I thank you all for participating in the hearing on this bill. Digital contact tracing applications are used in countries like Japan, South Korea, Taiwan. These countries have all contained COVID-19 far better than the United States has. These countries are also our source markets for tourism. So I believe if we ever expect to get tourists to come back to Guam during this pandemic, or even as the pandemic is winding down, we'll need to assure them that we're a safe destination. I think one way to accomplish that is to adopt some of the same practices that make them feel safe in their home countries. The bill seeks to allow for a modern solution for Guam residents to help prevent the spread of disease during a public health emergency. I'm hoping that by using the app, the public health can perhaps find some ways to do things like waiving mandates for individuals to stay in government quarantine facilities, instead having the person download the app that will track their location at the same time and ensure that they're staying at home quarantine if they're in home quarantine. So I understand, you guys, public health is currently using a mobile app for COVID-19. So of course, again, I'd like to hear from public health and the other professionals and see if there's anything in this bill that can assist them, or if there's anything we can add to this bill that can assist them. With that, I'd like to thank the chairwoman and of course, everyone else who showed up to testify on this bill, and thank my co-sponsors as well, Senator Jose Pito Terlaje, Senator Will Castro, Speaker Tina Rose Muñoz Barnes. Thank you, Chairwoman Terlaje.
Thank you very much, Senator Rigel. We now hear from Ms. Annette Uggan. If you could please state your name and position for the record.
Thank you, Madam Chairwoman. Honorable Senators, my name is Annette Uggan. I am the Administrator for the Bureau of Communicable Disease Control under the Division of Public Health at the Department of Public Health and Social Services. For the COVID-19 pandemic response, I am serving in the capacity as the Episurveillance Branch Lead, which oversees the investigation and contact tracing units. So thank you for this opportunity. It'll be pretty brief. We do appreciate Senator Rigel's support and assistance and his foresight to propose this bill. However, as he's mentioned, we have already launched the Guam COVID Alert app on September 10th with the support and assistance of OTEC. And so at this time, I do not feel that this bill is still necessary. Again, contact tracing is something that is one of the cornerstones for public health. Digital contact tracing is just a tool to assist with our current activities. Contact tracing is implemented regardless if a public health emergency is declared. When there is a reportable disease, be it a suspect or probable or confirmed case, our respective categorical disease programs under my bureau, as well as the new bureau that was recently created, the Bureau of Emerging and Infectious Diseases, that will be cross-trained to assist BCDC categorical disease programs. We actually implement case investigation and contact tracing for any reportable disease as indicated by Guam law, even for novel diseases such as the COVID-19. And so the tool again is just to assist us. It's not something that is necessarily used for every disease response and investigation. A manual is fine, especially if we're able to contain, especially some of these diseases that are like vaccine preventable, that are non-respiratory, that requires more direct contact. So we appreciate the intent. Again, we have implemented the Guam COVID Alert. And as of yesterday, I was informed that there are already 21,787 individuals who've downloaded the Guam COVID Alert app. And again, we continue to push for increased participation because again, it does take the community involvement to help make this digital tool successful, that we make it available free of charge. Moving forward with the new bureau that was created by our administration on October 1st, again, they will definitely implement this tool. And so that will definitely address the recommendations that Senator Rigel has mentioned about having a program, having someone oversee it. And again, this is with continued collaboration and support with our Office of Technology, who are the ones housing it on their servers. And so at this time, we respectfully feel that the bill is no longer needed. Again, we are using current COVID grant funding We have the support from Senator Therese Terlaje and the legislature for additional funding as needed. Definitely personnel is something we've asked for in the past. And we also have the administration support to continue to provide what is needed for the current response for COVID, but any other future outbreak. We have the CDC funding from the categorical disease programs that help with contact tracing and case investigation, again, vaccine preventable diseases like measles and pertussis or chickenpox. And so thank you for your time. And again, we appreciate all the support. Thank you.
Thank you very much, Annette, and thank you to you and your bureau and the entire department for the work that you are doing right now. I will now hear from Mr. Kai Akimoto.
Thank you, Speaker Terlaje. Thank you, everyone, for allowing us the opportunity to speak on this bill. My name is Kai Akimoto.
Hello, I'm Nicholas Akimoto. I'm currently a student at the University of Guam.
Hi, I'm a student at McAllister College in St. Paul, Minnesota. And we are both testifying on behalf of the bill.
Yeah, so once again, thank you for allowing us the opportunity to testify. We still believe that even though the app has been implemented and it is being used by people around the island, we still feel like the bill is necessary to be passed. Through our conversations with the public, we found that there are many concerns with the bill, a lot of them pertaining particularly to privacy of the app and the data that it's collecting. Now, the app as it is right now is very much in line with what we imagined when we first implemented the bill, or when we first drafted the bill in July. So through passing this bill, it will not impede the progress or how effective the bill actually, or how effective the app actually is. Through passing this bill, however, it will incite confidence in the people that they can trust this app. Many of the concerns are whether or not their data will be compromised. Through passing this bill, their data will be protected by Guam law, that it will be secure, it will be reviewed, whether or not it is necessary, and it will be routinely wiped once it is no longer necessary. Through ensuring the people that the data being collected is being protected, more people are likely to participate in the app. And while we do have a considerable amount of people participating in the app today, I believe the goal that was set when the app was first introduced was 60%. So as of today, we are not approaching that number. But I believe through passing this bill and inciting confidence in the people that they can get behind this bill, behind the app and trust it, then we will be able to see an increase in participation. Just one thing I want to talk about in pertaining to the bill is that there is a sunset provision on the bill, in that the governor will be reviewing how necessary the information that is being gathered is, and whether or not the app itself is secure. I believe that this is very important, as ensuring that the data is secure and is necessary is very important, because the data being collected is very invasive and intrusive in nature.
Yeah, so I'd like to speak a little bit on contact tracing itself. As a whole, contact tracing does require the collection of some private information. And one of the most ambitious programs launched was that of New York City, where they hired 3,000 contact tracers. However, they experienced some challenges very early on when fewer than half of their positive cases were comfortable enough to give information about their close contacts. So there was this hiccup in contact tracing, and this was just regular contact tracing without the aid of a digital app. So with that said, contact tracing is inherently intrusive. It does require private information to be surrendered, and it's also inherently difficult. As we see more positive cases and more close contacts arise in our community, the process becomes even more laborious. And I would like to applaud public health and the contact tracing team there. They're working tirelessly to try and identify all these close contacts and get them the testing that they may need, and the subsequent isolation if they test positive. And all of this is aimed at reducing this reproductive this effective reproductive number, which is a factor into our CAR score, which is supposedly what is the metric utilized to determine when we are supposed to see a return to more normal activity. So a systemic review by Juneau et al., which also includes on the author line, the famed Thomas Puello, who wrote the article the article that was credited for coining the term of flattening the curve. Anyways, this article identified that inefficient contact tracing with delays of 4 to 5 days to inform close contacts may not contribute meaningfully to the spread or to the control of COVID-19. So what this app is able to do is fill in those gaps. And I'm sure everyone here is understanding that, and we already have this app launched. But this app, like Nick was saying, does not reach that peak effectiveness until we have that minimum threshold of participation. And one thing that we aim to, well, with this bill are those concerns on the privacy regarding the app that may prevent people from downloading it. So now when we have these parameters specifically identified through this bill, people can confidently participate, knowing that there are penalties if they go beyond these parameters. So
yeah. So once again, I'd like to say that the bill as it is written is already being enacted, and public health and the app have already fulfilled all of the requirements. They're not breaking any the bill at all. So, but if we were to implement it, we'd be able to guarantee to the people that their privacy is being protected by law. So as of right now, nothing is being done in contrary to the bill. Nothing's being done in contrary to their privacy. But I believe that the people of Guam would feel much more secure, much more confident in the app if they were able to know that their rights were being protected by law.
Mm-hmm. The last thing that we'll leave you all with is that this bill only serves to support the app. And this app only serves to increase our contact tracing capability. And this is our contact tracing improvement is inversely proportional with the effective reproductive number, which, like I mentioned earlier, is a component to that CAR score. So as we reduce that effective reproductive number, we'll be able to see a more safer return to normalcy, and we'll be able to see this return to social gatherings and possibly even economic revitalization. So again, that's all we have. Thank you very much for all your time. And I apologize if that was a bit long-winded, but thank you everyone for your time. Thank you.
Thank you. If I could just clarify something. So the bill talks about the collection, I'm talking about on page 5, section 193A07, the collection of digital contact tracing data. So it says digital contact tracing data may not be collected from a mobile device unless each person who owns or operates the device has given consent. The department may offer as an incentive for providing digital contact tracing data, the option of in-home quarantine for residents of Guam. But when I heard the presentation of the app, it was my understanding that public health does not collect any data from this app at all. And that is actually, one of the guarantees we were given by the developers of this app, that public health doesn't collect any data from it. And no data is being collected by the government of Guam from that app. I don't know. Annette, if you could please, Ms. Uggan, if you could clarify that. Yeah, I don't want also the reverse intent, what you intend and what might happen. I don't want that to happen either, where people think now that we are collecting data when we are not supposed to be, according to the presentation that was given.
So DPHS will obtain digital contact tracing or location information only after a positive case opts in on their smartphone or provide DPHS with their location data. So it's the positive case that will give the data. It is scrubbed, de-identified, it's aggregated, it's brought up to the cloud, and then which is a totally separate app. The individuals who download the smartphone app will pull from the cloud this de-identified aggregate data that they can compare with their Bluetooth information on their smartphone. So again, it has to be consented before the positive case can provide us information. Whatever information they agree to provide is reviewed with them, because then they can also opt out on saying on this date, this time, and this location, I don't want it shared. And we respect that because again, they have the final say of what is being uploaded into the cloud that's de-identified and aggregated to assure, again, confidentiality. And again, as a hybrid entity, we are bound by HIPAA. And so those are the rules that we comply with, and we are faced with penalties if that should ever be violated. So again, those severe penalties that public health strives to ensure we never violate HIPAA. The other sentence, Madam Chair, where you brought up about the option to self-quarantine, we feel for that specific sentence, the option to self-quarantine should be based on public health assessing the ability for an individual to successfully and safely quarantine at home and the need for additional social support. So again, every individual has a different scenario, the number of household members, as well as the number of bedrooms and bathrooms in their house. And so that's something that on a case by case basis, public health will work with the individual to assess the ability for an individual to self-quarantine at home. And again, this is specific for COVID. Again, this is a novel disease. We're learning as we go along. For other illnesses, they don't need to worry about being quarantined at a government facility. We have it where they are self-quarantined or self-isolated home. There are treatments for it, therapeutic medication, or there's also vaccines to not only prevent it, but also to treat those who were exposed. So again, the contact tracing, the digital is always respective to that specific disease and its epidemiology. So it's not a one catch-all. Again, we have to adjust accordingly based on the disease that we are dealing with and the contacts that were exposed to that specific disease. Thank you.
Okay, thanks. Maybe someone messaged you that question. Yeah, I just wanted to clarify the privacy and what public health is collecting, but we're going to have our panel of senators ask questions, starting with the sponsor of the bill, Senator Ridgell.
Thank you, Chairwoman Terlaje. So yeah, my question would be for public health. With the current digital contact tracing app that you guys are using, and you kind of touched on it a little bit about how if you do home quarantine, of course, understood that it has to be assessed by public health to deem whether or not the home quarantine is sufficient. In other words, as you mentioned, whether or not there's enough room in the house so that the individual can be isolated, have isolated restrooms, et cetera. But with that in mind, currently with the app that you have now, are you able to use it, or are you using it in a way where you can have it track the home quarantined individuals if they opt into it, to ensure that there's sort of like a digital fence? I've read some places call it a digital fence. I'm not sure what it's exactly called, but basically the app tracks to make sure that you don't, if you're under home quarantine, that you're not leaving your home.
That's not the intent of this application, sir. The Guam COVID Alert app is a proximity-based application to see if you were in contact with someone who is positive of COVID. The request that what you're mentioning about tracking, again, even when this application was first going to be launched, there was a lot of discussion, and initially Apple and Google were looking at GPS, but because of the concern of privacy, confidentiality, they moved away from using the GPS location, and they did Bluetooth. It's not the ideal for public health. We would love to have something that's a little bit more closer. Again, that concern of, okay, are you on the first floor? Are you in a different office? Just because you're in proximity doesn't necessarily mean you were actually exposed. And so that was something, though, that, again, there are limitations to any technology. And this tool is something that, a new platform for us, and it's something that will help us with a novel disease and the response to the pandemic. So we gladly worked with it and the developers, and we tweaked it a little bit for Guam, and we've launched it. The other application you're looking for, again, that always goes back to invasion of privacy or Big Brother watching over that you're going to monitor where I move about. And so that's something that we always have to respect that line. But we have a different application, which is called Sarah Alert. And that's for also monitoring for symptoms and everything. That's helping for the isolation and monitoring. We are trying to see about how to reduce the human resource strains on our team, the isolation and monitoring team, because yes, you're hearing all this about teams having to go out and visibly see them to ensure they're there. And we rely on phone calls as well. We rely on individuals calling us. The SAR alert is for texting and messaging how they're doing, their symptoms. If they don't respond by a certain time frame, they don't answer that phone call, they're not at home, then that's where we implement a compliance visit to follow up with this individual. Because again, we want to ensure they're following the isolation or the quarantine measures that were provided to them so that we can help again contain the spread of the virus. I hope I answered your question, sir.
Thanks. Yeah, I just wanted to sort of clarify something. So you mentioned it's Bluetooth, this current app. It's not it's not a GPS enabled, correct?
Correct, so because that was one of the biggest concerns that Apple and Google recognized. And so that was something that was on the table in the beginning. And again, this product has changed. It went from Safe Paths to PathCheck, and for Guam, we call it Guam COVID. So in recognizing the need to ensure confidentiality, privacy, they moved away from the GPS and they just used the Bluetooth technology, sir.
Is there any way to adapt the app? I understand there's concerns, of course, about privacy, but again, that's the idea is to have people opt into it. So, for example, in lieu of staying in a government facility, because a government facility is certainly not private. Your whereabouts are known. You're in a government facility. You cannot leave. They know if you leave. If you're caught leaving, you're in trouble. So they know exactly where you're at all times while you're in a government facility. They even know when you eat, so to speak, because the food's delivered to you. So how about, is there a way to sort of adapt the app so that for people who qualify for home quarantine, they can be taken out of a government facility, opt into an application that will ensure that they stay at home by using some sort of digital fence around their home location? And the reason I'm bringing that up is my understanding is some of the Asian countries that I mentioned earlier are using that type of technology. I believe they use it in Taiwan and Hong Kong, if I'm not mistaken, perhaps South Korea. I don't remember exactly which ones, but I know some of those countries are using it. I believe Hong Kong and Taiwan are using something to that effect, so that it provides sort of a digital fence around their house. And if they leave their house, it goes off, and then they get fined for leaving their house. But, of course, for our purposes, I'm thinking we would ensure that it's something that someone opts into. So in other words, it's like, if you don't want to stay in the government quarantine facility, you can go home, but you have to opt into this app that's going to prove that you're staying home. Is there any way to adapt the current app for those purposes?
Technology-wise, sir, I'm the last one to say yes or no. I definitely would defer to Office of Technology that have the more technical expertise than I like your thought, and I dream big when it comes to the use of technology as well, and that would be great, would definitely help public health and Guam overall. But I can definitely take that question, sir, to our Office of Technology, as well as our IT folks here at Public Health, so that we can give you the best answer. And again, I apologize, I'm not the right person to give you that on the technical aspect, but it's something that would be great if we could implement it as well.
I could just clarify too. I don't want anybody to who's listening to walk away with. There are several apps that are being used. So one is the COVID-19 app, as Annette Uggan is describing. This is simply to let people know it's a contact tracing app, whether you have been in contact. It's only going to alert you whether you've been in contact if the person who tests positive inputs that positive into the system. If he inputs the positive, anyone who's been near that person will be notified that they were in contact. That's it. That's the one app that we have. And there are other apps, as she described, that we are using, separate apps that are helping them to monitor those who are in home quarantine or isolation by checking in with them, putting in the data as to those who they consent, they're in quarantine or isolation. Yeah, I just don't want those to be confused. So I'm thinking, yeah, maybe what you're describing might be in the other app more applicable. But anyways, all right. Any other questions, Senator Rigel?
No more questions at this time. Thank you, Chairwoman.
Thank sorry, Senator Jose Pedro Terlaje.
Thank you very much, Senator. I just want to thank Kai and Nick Akimoto for their efforts, because they have been working at my office with other friends of theirs and the Speaker's office and Senator Rigel. And the idea was simple, to create a contract tracing application that would work in the background of our residents' mobile devices, protecting the anonymity by using standard developed by the UK Data Protection Act of 2018. It used to only randomize the autonomous data used by the Bluetooth as its tracking methods. And you know, Madam Chair.
Forgive me, Senator, sorry, but can you turn on your video, please? Yeah, I think it got turned off accidentally. Sorry, but according to the rules, we need to have it on. Yeah, thank you.
And let me just say, Madam Chair, that as the chairman for border safety, I feel it is imperative that we ensure the safety of our residents, and robust tracing program is required for that. My office has worked in bipartisan efforts to create a rapid testing program at the airport as a way to create a travel bubbles with our source market. With the authors of the legislation to mitigate the spread in our community, and have written letters to Yale to attempt to become a partner with their rapid saliva PCR testing that was created by MBA and Yale to produce a rapid test that costs around only $10 and would provide results within 20 minutes. So that's what we're looking for. And I want to thank Kai and Nick for their efforts. Thank you. Thank you, Madam Chair.
Thank you, Senator. Minority Leader, Senator Terlaje.
Thank you, Madam Chair, for the opportunity. And thank you, Annette, for all that information, and really appreciate the hard work you're doing. And, you know, to the author of the bill, Senator Rigel, I really appreciate this. He introduced this on July 30th. So way in advance, the idea was there, trying to, play a role in this, in trying to do the contact tracing. And it's commendable for doing it. But, you know, currently right now, as mentioned from Annette, that we have a contract tracing program. So my question, Annette, I don't know if you or Department of Public Health can answer it, but under what legal authority is the current contact tracing program authorized?
Again, it's used as a tool that already through, sorry, I'm blanking, Senator, but as for reportable diseases, we use that for any, again, case investigation and contact tracing. So this is just a tool to help us from doing the manual. And again, this digital tool we may not necessarily use if it's a smaller outbreak or a cluster, or even if we have just like one case of, for example, measles, we would just focus on the close contacts using paperwork, not having to implement the digital contact tracing tool, because again, each disease is different. The vaccine preventable diseases, once we identify the contacts, we can immunize them within the recommended time frame, or there are medications that can help prevent the individual should they be exposed to a communicable disease. And so again, it's part of our existing. The contact tracing case investigation are tools that we've used for decades in the nation. And so we use it as part of our, I apologize, I'm blanking, it's for the 10 GCA for reportable diseases and for our surveillance, ma'am.
Thank you, Annette. You know, I guess, well, this is definitely something new, and I'm pretty sure that you're taking all these notes with regards to what is needed as we move hopefully get past this, but putting some rules and regs and some more ideas toward this type of technology, because I'm pretty sure there's going to be quite a bit more out there that's going to be implemented and brought to the forefront on helping to do tracing, contact tracing, notification, different types of methods to curve this, as Akimoto said, try to flatline this situation that we're in. Greatly appreciate the Akimoto boys for being here today. I just wanted to mention that. Gentlemen, thank you. And I know you've been working with some of the other senators. So feel free, my door's open too. I'd like to hear what you guys have to say. Other than that, Madam Chair, thank you for the opportunity to speak. Thank you.
Thank you too. The birthday girl now, Senator Luis Muñoz.
Hey, thank you. Thank you so much. So I'm just going through all of the aspects of the bill and just trying to understand, the differences between what this bill is requiring and what the app is doing now. And I guess it involves actual humans inputting information into a specific software for this contact tracing. So I guess part of my concern really is all government entities are all subject to FOIA, right? And so how would we be able to contain some information that are inputted that maybe could be subjected to FOIA? How do we address things like that? I mean, I guess it could be for Dr. Anaragan or maybe the author of the bill.
Well, I think, oh, sorry, Mr. Net, I'll give you.
Oh, okay, go ahead, sure.
I'm just trying to clarify can you please repeat your question, Senator? I'm sorry.
Yeah, so I'm just concerned about the data that's being inputted into the software for digital contact tracing, and would it be subject to FOIA, or how do you contain information that maybe shouldn't be released out to the public if for say, the agency was FOIA'd?
So the data that's being uploaded to the cloud is already de-identified and aggregated, so there's no way to pin it back to a specific individual. There are only codes being used that are uploaded, and then the individuals who download it on their phone, which is a different application, will download those codes, I apologize, and they have their own codes, and so it's the codes comparing each other. So individuals would not know this code is to Juan Cruz and this other code is to Jane Cruz. No, ma'am. It's de-identified, aggregated, so it is will not violate HIPAA, and so that there's no way that this data that's being shared for people to see if they've been exposed can be linked back to a specific individual.
Okay, and then am I correct? And if I heard maybe one of the Akimotos was saying that it does have a sunset clause, like a timeline, and what's going to happen in this bill if say, for example, the COVID is contained, will the information that goes into particularly for COVID, would it eventually just disappear? What happens to that information?
So I can speak on that. According to our bill, the data that's collected will be routinely wiped once it's no longer necessary after a period of 2 weeks. And according to our understanding of how the bill or how the app works now, I believe that should be the case. So once we hopefully reach the end of this COVID pandemic, if the governor, after review, sees that this app is no longer necessary and it's no longer COVID is no longer a threat that needs to be detected in this way, at that point the governor would then take all reasonable steps to ensure that, or to close down the program.
Yeah. In addition to that, the bill also calls for the routine reporting of the effectiveness of the digital contact tracing to the governor to make that decision. So as the bill would require it, the investigations that are launched from the use of that, from the app itself. So let's say a close contact is identified through the app and an investigation is launched through that. What is the effect of that to the effective reproductive number or to the overall community transmission. And those are things that this bill would require be reported to the governor to make that informed decision on whether or not this bill is, or sorry, this intervention or done in this methodology is required. So, and that's a actually rather key component of the bill, that that information is made available to the governor. That aggregated data, not necessarily. And again, Ms. Huggan is absolutely correct in saying that this information, as used by the Guam COVID Alert app, is de-identified. And but this bill also ensures that any application utilized would only work with anonymized data. So thank you.
Okay, thank you. Thank you, Madam Chair. That's really all of the questions that I had for now. Still be intently listening to all the other questions, but I want to thank Annette again for being a part of, and watching the Akimoto boys testify too makes me feel a little bit older, even though today's my birthday, because I practically watched them both grow up. But thank you again, Madam Chair. Thanks, Kai and Nick. Thank you.
All right, and Senator Castro said no questions right now, is that right?
Madam Chair, just a brief comment. Yeah, again, thank you to the Akimoto brothers. They were very aggressive. I had an audience with them when they presented the idea, and then we partnered with Senator Rigel in taking the lead. So thank you, Senator Rigel. I think it's important that we see the bill go through with whatever amendments may be made by the chairman and the committee. It sets into motion and it establishes by statute how we handle this data, especially in this using this new medium. And so it's worth consideration and further discussion, but I want to thank you publicly, the two young gentlemen there, for having the foresight and being very persistent to see this bill written and introduced. Thank you again, Senator Rigel.
Thank you, Senator Castro. Senator Shelton, Legislative Secretary, Senator Shelton.
Thank you very much, Madam Chair. Thank you to Public Health and to the Akimoto boys. Thank you very much for being here and for presenting your testimony and all the work that you did on this bill. Annette, maybe just one question. I know that the department feels that this bill at this time is now not necessary, but is there anything that we could include in this bill to help you with your current efforts with the COVID-19 app? Is there something that we could include aside from helping you gain more personnel to help you with the contact tracing, to promote this app, to the number of people we need to download the app for it to be effective? I really appreciate what the Akimoto boys had to say about giving our community a sense of trust in the app for us to pass this bill and show that we as a legislature are behind it and the efforts of public health. But is there something that you see that we could include in the bill to strengthen that effort?
Thank you, Senator Schultz. That's a very good question. One of my last bullets here is what the needs are, is which you've already mentioned: funding source to implement, administer, and sustain this proposed program, right? Because it's not indicated in the bill unless I overlooked that. But for me, in regards to the education component, just getting out there to educate all our brothers and sisters on this island from the different ethnic backgrounds to ensure that it is at least at fourth grade competent literacy level, because again, there are some individuals who they have the smartphone, but they're not so tech savvy, and so we want to again, like the Akimotos have mentioned, we want to make sure that we increase that download to reach that goal, and have people be confident. And it's always about educating them and understanding the purpose of the tool, that it's safe, that we will ensure privacy. That's our utmost goal at all times. And then it's just to help them know whether they've been exposed or not. So for me, one of the biggest ones, probably additional for educational campaign, translation, interpretation services that I know our team has been working with the JIC and the different, as well as GVB and the Consulate General Office. But again, just something so that we can get it out in all languages, get more people educated and reassured and confident into downloading and using the app.
Okay, thank you very much. I appreciate that. And I know there are different community groups who are helping you to spread the word and to get out into their different communities so that they can encourage people to download the app. And I know some of the senators here have been doing that as well. So any efforts that we can make, I'm sure everyone here would be really supportive of that so we can assist you with your goal. So thank you. Thank you, Annette.
Thank you,
And
Senator.
thank you to the Akimoto boys. Thank you. And also to the sponsor and co-sponsors of the bill for this foresight and helping us to try to flatten the curve and do everything that we can.
Thank you, Senator Shelton. Senator Moylan.
Thank you, Madam Chair. On the app, question for Annette, it asked me for example, I was just trying to walk through it, verification of your diagnosis, and you had to get a code. Is that coming from public health? Have we actually, of the 21,000 people that signed up for this, has anybody contacted and entered a code and we see it works?
Yes, I was just informed that approximately 50 of the positive cases have agreed to upload their de-identified data. And so that I know is a work in progress to get more into using it. And again, it won't stay at 50. The information is set for 14 days, the infectious period, and then it'll drop off. So that number will continuously change. So as a case is cleared out from isolation, no longer infectious, their information will drop off. If a new positive is diagnosed and is agreed to share their information will be uploaded. So that definitely is an ongoing continuous changing number, sir. And more details I can definitely get back to you, sir. We have a team, our PIO, Janella Carrera, as well as our, she's over at the Joint Information Center, Grace Berdile. They're definitely the ones overseeing and getting that data in regards to downloads and usage, so that I can provide you more details for that, sir.
And one last question, Annette, what is the cost that we paid for this program so far?
So currently for public health, it's free, thanks to the developers. They actually, and OTEC, they put in a request to waive. There was about approximately a $30,000 fee, but Guam was granted the waiver. Right now it's Office of Technology who is hosting, and so that's about $1,000 to $2,000 a year is my understanding that OTEC is absorbing with their existing server. So that kind of would go back to what Senator Shelton asked about what else would we need. I would think maybe just another server, but again, our department has also various programs who's purchased servers, and so that might be something whether to pay for the annual fee. But thankfully, the PAF check was gracious enough to grant us the waiver for the more expensive $30,000.
Okay, thank you, Annette. Thank you, Madam Speaker. Or I'm sorry, Committee Chair.
Thank you, Senator. And Speaker Munoz-Barnes.
Thank you, Madam Chair, for the opportunity. And I want to thank the author of the bill for giving me the opportunity to be a part of the co-sponsorship. And I want to thank the Akimoto brothers for taking the time to visit me and talk about this issue, to Zoom in with me. And I want to share that even as late as last week, I know that public health has been really working hard to see what any means possible to get the awareness out there, how we can jump on this app program. But more importantly, the thing that's come back to us was, in order for it to be successful, is how can we get the information that is compiled by I guess the numbers and the programming that's closely being done by public health. How does that information get back into the system so the alerts can go out in case someone is in close proximity to one that is not? So I think maybe that would be the first question to public health, and as far as the data that's needed when the information is received. And if I'm saying anything out of tune, please go ahead and correct me. So Annette,
Sorry, Madam Speaker, I'm trying to understand your question.
the information, so when the consumers get on to the program, in order for it to work, there needs to be the information that I guess public health deals with, and as far as the receiving of the COVID positives or what have you, as it relates to number codes or all that, that should be injected into the program so that those that are within that vicinity, right? Somebody would get alerted. Am I saying that correct?
Yes, ma'am. Sorry, I'm not even, how am I gonna explain this too great with low tech myself. It's pulled from your phone, the positive. Again, it's uploaded into the software, which is on a separate application. This is not accessed by anyone in the public. It's a totally separate, where this de-identified aggregate data is put in. There are some coding that is done, again, more technical, and then it's uploaded to the cloud, which is again it's totally separate. And then that's where with the Bluetooth technology, it gets downloaded, and then it's all done automatically with different codes for the location, the time frame, and then that's where your technology would compare on your smartphone and would flag you whether, yes, you meet the criteria that you may have been exposed to someone based on the parameters of being in close contact for 15 minutes or more. I hope I'm explaining that correctly, ma'am.
Yes. And I really appreciate that, Annette, because with that process, we get a better understanding. So my take is, has that information been inserted into the program for utilization? Because when the question was posed by some of my colleagues, it was, how strong is the information being inputted into the data processing component? I understand it's all done in codes and one doesn't know what the other is doing. It just all works through the numbering system. So I guess my question is has the information being inputted through, let's say, someone at public health, or does it take another equation to work with? And I know that OTEC has been very supportive in the efforts. I know that there is a public-private partnership that has been doing this for free also, I guess, because it's in partnership with other big, I guess you would say, like Google or what have you. The reason why I'm asking is the information is not being received. I had a call from a constituent saying that, well, you know what? I'm on the app, but I know somebody who's right near to me and it didn't go off. So does the app work or not? And
So
maybe that's a basic question that I should ask.
So without the digital tool and the manual process, contact tracing is only as good as the information the positive case gives us, what they're willing to share. So be it manual or be it digital, if that person is withholding information, withholding dates and location they've been to, withholding information of who they've been around, unfortunately, that's the best data we have. It's incomplete. And so even on the digital part, again, we've only had about 50 positive cases willing to provide their data, and they still also have to approve what we put out for them. They can say within that 14 days, looking back, where have I been in the past 5 days during my, the start of my infections period. If they don't want to put all the locations, we have to honor that and respect it and delete it. So then partial information is being uploaded onto the cloud for someone who has the application. So even though they know, but what is approved by the positive case for public health to share is all that we are allowed to put up into the cloud and share with individuals who've downloaded the application. So again, we work, and again, that's why we keep saying it's not just public health, it's a community-wide effort. We need help. Yes. We go off of information provided to us. We work as much as we can to have that rapport and build the trust with these positive cases to get the information. And sometimes it's actually not even the case. It'll be family members or others who say, you know what, he's not telling you everything. These are the, or she's not telling you they've been here, here, and here. They were symptomatic actually before that. So again, we're relying on all the reliable, valid information coming to us. And then again, it's what is approved and allowed for us to share with the public.
So I think based on that scenario is, how do we bring the collaboration in together, and how does that information get put into the system so that the application can work? And I really support this effort, and you're right, it needs that concerted effort. So if there is anything more that we can do to assist in making sure that the information, the crucial information that's needed to go into the system, into the database, so the alerts can go out, I think that's where we need to bridge the connection even more. So I'm hoping to work closely with the author to see what more we can do to include this, because it is successful in a lot of the other countries that it's being utilized for. The difference is ours is voluntary. Everywhere else in our social markets, it's mandatory. So I think that's the differences in how this program works to be successful. But Madam Chair, I just want to thank you for bringing this bill to the forefront. I think it's still very important. It's very crucial, and hoping that we can get more positive support from all the stakeholders, even within the community. So thank you for that. And thank you, Annette. I truly appreciate your process on sharing the guidelines that is needed to make this program work. Thank you. And to the Akimoto brothers, Sizus Masi.
Thank you, Speaker. My apologies. I know we have still Senator Kelly Marsh-Titano for questions, and then closing by the author. I would like to ask a couple questions to myself, but Ms. Uggan has another commitment at 2 o'clock. So if you need to leave, I just want to ask.
No, it's okay. I message, I'll be a little late. I want to be respectful of your time, Madam Chair, and as well as for Senator Marsh, if she wants to, Marsh-Titano, if she has any questions.
All right, so Senator Marsh-Titano.
Sizus Masi, Madam Chair, and I apologize for being late to this hearing. And so just let me know if it's already been covered, but one of the issues that stood out to me that I wanted to have some clarity on is in the collection and deletion of contact tracing data. And so in my reading through this, with the deletion of digital contact tracing data held by an authorized person, to delete it as soon as practical. So I'm wondering, does it still stay within a database? It's just the people who are interacting with it would delete it from their systems to maintain the integrity, or is it completely removed from all elements of the contact tracing app?
The digital tool, yes, ma'am, that information is deleted. There's actually even, you can set the time frame on the back end of to how long that information is shared. You can actually even make it longer than 14 days, especially if someone was symptomatic and days before they were tested, and so it's actually going on more than the 14 days. So we have that flexibility, but once you set the time frame of when to end, it'll delete out of the system, ma'am.
Okay, and thanks for clarifying that, because as I said, I wasn't quite sure. And the one reason I wonder, well, there are a couple of reasons, but one of the reasons I wonder is, as a social scientist, when we have data, there's all sorts of patterns or other things that may show up later with the collection of other things. But is this just felt to be parts of the data that aren't going to lead to larger conclusions or patterns or anything that would have later usability in your assessment at this point?
Well, it would definitely help us see a bigger picture. And again, based on what information is provided to public health, by having others download, again, if an individual is keeping information close to their breast, or they're not sharing the number of people they were in contact with during their infectious period, by people downloading the app and it's flagging them, then it can say, okay, wait, there was a gathering. How come we're having so many people pop up on this date at this location at this time that, again, a person may not have been forthcoming with. So this is one example where the information, if we have enough users to download and use it, and people are providing the data where they've been, then hopefully we can then find, unfortunately, more close contacts that now we have to interview and also look at offering them testing.
Right, and yeah, it is contingent upon our voluntary nature, and so I hope that we continue as a body, like each and every one of us here and across the government, to encourage the downloading because it's just not happening broadly enough. But I think what you're saying is maybe the personal data is deleted, but some of the general data, maybe location, size of gatherings that were or were not infected, that can still be maintained for later, larger analysis of patterns and behaviors and things like that.
Oh, no, ma'am, sorry. That would be if someone gets a flag on their system that, yes, you might have been a close contact, then they have instructions to call public health. So that necessarily wouldn't be on their phone. It's, God forbid, if they turn around and become positive, are they going to share their data? And then it just becomes like a branch or keeps going outward, this concentric circle of possible contacts and exposure. And then we keep working our way out. So that information, once it's deleted from the system, it's deleted. But the information we gather, we have on our contact tracing forms. We have case interview forms and contact tracing interviews that we would keep and we would refer back to. And again, that's on a totally separate, that only public health access due to confidentiality and the HIPAA, that we would still maintain on our side, ma'am. But up for this app, it would be deleted out.
I see. Okay. Well, thank you for providing that clarification. I wanted to make sure that there were both realms, that the personal data was given a real strict privacy and deletion, but that there was still some data that might be useful for other bigger picture items that might still be available. So Sejus Masi, Madam Chair, for allowing me to ask those questions.
Thank you. Yeah, I just want to, I'm very concerned that we're talking about many different things here in this hearing regarding this bill. There are several apps that public health is using, and I think sometimes we are overlapping them in our discussion. We're supposed to be talking about contact tracing app, which is this bill, and so prior even to July, public health had been discussing this contact tracing app that we are currently using, called the COVID-19 app. That app was developed by, we know Google and Microsoft, I think, or Google and Apple, and local developers and OTEC. So they pretty much took the lead of that, and they've given us their presentation. And in their presentation, they made it very clear there was no data being collected by the government of Guam. The government of Guam, when you come to them and tell them you're positive, they're going to give you a code. You enter that voluntarily in your app, and it's going to notify anyone who had been near you, according to the specifications. But at the same time, public health is also doing, as Annette keeps describing, their contact tracing, because just because you enter it into the app, they're still going to follow you. They're going to get your information. They're going to put that into their systems, and they're going to trace you and do contact people. They haven't foregone this manual system at all. They need that, because that's how we're going to determine, whether somebody needs isolation or not, and whether they need testing, as she said. Anyways, we don't have time today to talk about it much more, but I just know maybe we need to, just have the government needs to have a reminder about that COVID-19 app, and what it does, what it does not do, and everything else public health is doing either by its other apps or manually. And so I too want to thank the Akimoto boys. I think men. What is important is it's the intent that we want to assure the public that this COVID-19 app that they're currently using is not invading your privacy. That was the biggest push, and I don't want this bill to detract from those efforts where they try to assure everyone they're not collecting your data. Now, this bill proposes that public health develop a contact tracing app that will, collect location data, do some other things. And so I think, we will discuss this a little bit more with public health, what exactly they still need that I don't think we're going to get it out of this app because of the way it was developed, but whether they still need this authority to develop another app for additional information. But I do share your concern that people, especially, they need to trust whatever apps are being implemented by public health. And I was told, I think in another meeting, that you were going, or maybe on Dr. Wen said it on the air, that you were going to assist with a public PR campaign to help assure people, I guess, about the privacy of the app, but also, about this contact, for your generation, to help them to. And so I wanted to commend you for that too, that he said you were going to take the lead and how to communicate with those of your generation to follow the rules that we've been trying to follow. So thank you. And so I'll let the sponsor, Senator Ridgell, close on the bill.
Thank you very much, Madam Chairwoman. Just real briefly, first of all, forgive me in my opening, I forgot to thank both Kai and Nick Akimoto. Thank you so much for the two of you. That's how this whole bill came about, actually, was Kai and Nick Akimoto reached out to me. They asked to meet with me and talk to me about contact tracing and digital contact tracing. And then with that, they met with some other senators as well. We all worked together, and they actually helped with drafting the bill and providing language for the bill with our offices. So thank you too. I think you're both very bright young men, and you had a great idea here with this bill, and I really appreciate it. And with that, I'd just like to say thank you, and thank you to everyone for your participation and all of your comments on the bill, so that we can think about it and see if the bill can still help out in any way. As the chairwoman was mentioning, if there's any need for it to provide authorization to allow you guys to be able to do something else that's not being currently done with the app, like for example, the home quarantine with location tracking to ensure people stay at home if they opt out of the government quarantine facility. And the reason I'm really thinking about that a lot is I do know of people who were supposed to be home quarantined. They flew in from off island, they came home, they were sent to home quarantine, and they violated home quarantine and they went out. Matter of fact, I called public health on someone who did that. Maybe I shouldn't say, now that person might know it was me who. Regardless, I knew of people who were violating home quarantine, and I have contacted public health about people I knew who were violating home quarantine. And I've also heard stories from other people, of course, about people violating home quarantine. So that's why I'm thinking that, that's something we should really take a close look at. How can we ensure that people are staying home? With that, thank you again, everyone. Thank you, Madam Chairwoman, for the opportunity. Thank you.
I want to thank Annette also for for her insight. Thank you very much, Annette.
Thank you, Senator. Thank you.
So thank you, and Kai and Nick Akimoto. Thank you, Annette Uggan and Public Health, and thank you, Senators. There being no further individuals to prevent testimony, the committee will consider this bill 387 duly heard. The time is now 2:15 p.m. Okay, so as I said earlier, we're going to jump now to the hospital bills, which begin with bill number, because they've been waiting, bill 301. So bill 301, I will allow Senator Shelton to introduce the bill.
Thank you very much, Madam Chair, for hearing this bill today. And I'd also like to thank my co-sponsors, yourself, Speaker Amunia Barnes, Vice Speaker Talina Nelson, Senator Joe San Augustine, Senator Will Castro, Senator Clint Rigel, Senator Kelly Marsh Taitano, Senator Jim Moylan, and Senator Pito Terlaje, Situas Masi. Bill 301-35 is an act to add a new Article 9 to Chapter 77, Division 2, Title 12, Guam Code Annotated, relative to authorizing certain tax credits for required medical equipment and electronic health record system for the Guam Memorial Hospital Authority. And I'd like to thank our hospital administrator, Lillian Posadas, who is here with us today to provide testimony. Bill 301 is a really simple bill that will allow us to authorize tax credits for a new EHR, electric health record system, which we've been hearing about in our many oversight hearings of the hospital during the budget hearing, as well as needed medical equipment for our only civilian hospital, our only public hospital on Guam. And as you know, Madam Chair and members of this committee, the hospital has a running wish list of equipment that they need for every department of the hospital. And if you've been there lately, if you've visited a relative, or if you've been in the hospital yourself, you know that our machines and our medical equipment are quite dated, many times out of commission, and we hear it all the time that we need modern care at GMH. And I'd like to applaud all of our GMH staff and the team there who really make the best out of what they have. And I think we've seen during this time of the pandemic how these problems have compounded, that we have an increased need to purchase medical equipment and at a quicker rate these days, to ensure that we are able to grow the capacity in the hospital to meet the needs of everyone in our community. And so I thank very much again the administrator for being here today to help us walk through this bill and to share your thoughts, and welcome the contributions of our colleagues to strengthen this measure and to bring even at the small amount that it is compared to the huge needs of the hospital, even this little amount can help them along the way. So thank you very much.
Yes. Just want to note for the public that so the bill allows $5 million total tax credits, $1 million a year, and it allows it to be extended if it hasn't been used. I want to recognize President Lillian Posadas, Administrator of Guam Memorial Hospital, also Dr. Annie Berdalia, who's the Medical Director, Dr. Jolene Uggen. She has many titles there. So Dr. Uggen, I'm just going to say Dr. Jolene Uggen, one of our heroes there. William Kando, Ron Rabanal, who's the Assistant Administrator of Administrative Services. And so I recognize that all of you are here trying to make use of your valuable time. Thank you for being here. So Lillian, if you would like to testify, the mic is yours.
Yes, thank you. Thank you, Senator Terlaje, for giving us this opportunity. And thank you, Senator Amanda Shelton, for your foresight in introducing this legislation, because it is, we support it. It provides a mechanism and a source of assistance in the form of unpledged BPT credits, tax credits for the hospital, to then, work with a not-for-profit organization that can acquire. Sorry about that. We have our overhead system whenever we're transferring COVID patients, just to make sure that the floors and the areas are cleared when we're transferring COVID patients throughout the hallways. And so thank you again for giving us this proposed legislation that will provide a mechanism and a source of assistance in the form of unpledged BPTs credits for the hospital to work with a not-for-profit organization that can acquire contributions and donations on behalf of the hospital, particularly to procure medical equipment. Because as Senator Amanda Shelton pointed out in her opening remarks, that many of our medical equipment are outdated, and with today's medical technology, the lifespan of these equipment wears out, and there's always new equipment that need to, that provides a more up-to-date type of diagnostic procedures, and even just monitoring patients with their vital signs. And so we do have a not-for-profit organization working with us already. But again, it's just this legislation will definitely give them the additional financial assistance, because they are very much actively engaged with the community to raise funds for the hospital, to work with businesses, to bring in some funding sources that then they channel those funding for medical equipment, especially the big ticket items, for cardiac care, for radiology and interventional radiology procedures. And so this will help definitely the organization, the not-for-profit organization that supports Guam Memorial Hospital. So any support we welcome, and we truly appreciate, and we commend Senator Amanda again for her wisdom in crafting this legislation. So thank you on behalf of the hospital. And we do have one of our board members, Trustee Sarah Nedadok, also in our presence. So thank you.
Thank you. I wanted to recognize Sarah Nedadog. Thank you. Yeah, trustee, one of the board of trustees of the Guam Memorial Hospital. Thank you. So now we will start with questions from the sponsor, Senator Shelton. Is there anyone else who wanted to testify on the bill? All right, Senator Shelton.
Thank you very much, Madam Chair. I don't have any questions. I think Ms. Lillian touched on some of the needs of the hospital, the equipment that they can use the money for, highlighted a couple of things that are always in need there. And so that's what I wanted her to today highlight, so that we can really understand the need. Though I know we don't really need that kind of reminder, since it's always in the news, it's always presented before us that this is something that has been a long standing problem, always trying to get the resources to our hospital. And so I appreciate the testimony today.
Thank you, Senator. All right. I just want to point out that, so we did receive a fiscal note from BBMR on this bill. It's quite lengthy, so I'm just going to kind of summarize excerpts of it. And so I'm the first co-sponsor of this bill, but this fiscal note says that he talks about the 5 million of credits against unpledged business taxes, with a limitation of 1 million in tax credits per year up to 5 years. The bill will allow extension, and the legislation will authorize GIDA to charge a processing fee of 1.5% of the amount of tax credits approved, which shall be used exclusively for tax credit program activities. They note that per GIDA, the cost to administer the tax credit program is between $8,000 to $10,000 annually. They are unable to determine the true impact the government of Guam may face. However, the Bureau notes it is concerned that the use of tax credits will impact the government's ability to manage the finances of the government, as it will reduce the expected revenues due to the government. The filing of tax credits by the taxpayer will take priority over appropriations made in the annual budget process, which may impact government programs. All right, so for my questions, I just have a couple. One is, so the bill says it will be used for equipment as determined by the hospital. So the hospital will be the ones to determine their priorities. But it does mention the EHR system and the, of course, electrical repairs. And I just wanted, if Lillian, you could just very briefly tell us, it's our understanding that the EHR system is taken care of now. So none of this tax credits would go towards that. Is that correct?
Correct, Senator, Madam Chair, that has been already initiated. We've launched already the process and it's going very well. And so the go live date is scheduled for May 2021. And so we've engaged the company MedSphere, who is an affiliate with Cantata Health. So through the innovation process, we were able to successfully then get their services through an agreement. And so we've engaged their services, they're communicating with them, meeting with them. There's been training, ongoing training. And so, yes, that process, the electronic health record, the transition from the Optimum by Cantata Health is now going to go to MedSphere CareView. That's the name of their product of EHR. And that's ongoing and it's going very well. So we will transition into it effective May 2021. And the doctors have been involved in it. They've done some test demos with it. They're very pleased with it being user-friendly, more efficient, and easier to use and easier for them to do their documentation. So, we're very pleased with the progress of that.
Right, and you were able to find operations funds for that. Is that correct? So I just wanted to thank you.
And we are.
And I know you've been updating us in the media regarding the electrical repairs being made, the negative pressure upgrades on the floors and the backup power generator. So I'm going to skip that, but I just want to maybe say for the record that you are using CARES funds money for equipment as needed. Is that correct? And so
that is correct.
Okay. Okay. All right. Thank you. Okay. Again, so Senator Pito Terlaje. Oh. All right. Senator Terlaje.
Thank you, Madam Chair. I fully support anything that's needed. Lillian knows I'm also an advocate for the hospital, been from day one. However, the bill was introduced, I believe it was introduced February 21st, 2020. Way before we came in this COVID situation and financial crisis. I guess let's start with my first question. A not-for-profit group getting tax credits. I always thought that not-for-profit groups don't pay taxes. So how are they able to get tax credits if they're a not-for-profit group that doesn't pay tax credits? Is it funneled through another organization or?
The tax credits that are unpledged is what I understand. So that's what they will be getting. The organizations will be getting that. GIDA will be the one responsible to keep track of those. And so then.
No, that's not what I mean, Lillian. I know what you're getting at. What I'm saying is that the ones who are going to take advantage of this tax credit are not-for-profit groups, like an organization like Regalu Foundation or the volunteers, the GMH volunteers. But if I'm not mistaken, they don't pay taxes because they're a nonprofit organization, a nonprofit or a not-for-profit. So these tax credits are going to go to an organization that doesn't even pay taxes. So how is that supposed to help them unless they purchase an equipment? The only thing I can think of is that they go and they purchase a respirator, for instance, for the hospital, and that individual company then takes advantage of the tax credit. So I'm just off-island companies, when a lot of times the equipment that's purchased is done off-island, and those off-island companies can't avail themselves of tax credits. They're not required. But anyways, I'm sorry, Madam Chair.
No, good question, Senator. I just want to note, we haven't received legal review of this bill yet, but I would ask if the sponsor wants to yield. Otherwise, we will take note of all of those questions and try to
thank you
their answer.
Sure. Thank you very much. I will yield to the question. The idea is not for the not-for-profit groups to receive the tax credit. It's for a not-for-profit group to be recognized by the hospital to be the pass-through for the funds, to receive, to be the beneficiary of the tax credit, and then to assist with the purchasing of the equipment. So I will give you an example. The Guam Memorial Hospital Volunteers Association has been working with the hospital to purchase the equipment for the hospital, many things in response to COVID, and to help them build new things within the hospital. So it's for GMH to recognize a not-for-profit group to assist them with this. So it's not to give a tax credit to the not-for-profit group, but to allow for them to assist the hospital with it.
Okay.
Facilitating.
Okay, because the way I see it, someone is going to get a tax credit here, right? And one of my biggest concerns too is because of the FY 2021 budget being so tight the way it is right now. This, and of course, this bill being introduced in February, again, not knowing the crisis that we were in, and we're just short in many ways, short with other agencies, and we're doing everything we can possible. It's good to know, Madam Chair, that, Lillian mentioned that they're using COVID funding, and that's really important right now that we utilize that money. I mean, it's only a month and a half away before we lose anything that we have not spent on, and that would be just a shame if we didn't. But again, I'm concerned about this tax credit. What is it going to cover the shortfalls of, even though it's 1 million a year, that means 1 million of an agency not getting their funds. And it's a big concern at this point. Tax credits are not, always necessarily the right way to go to balance a budget or to even, utilize finances within your own, the government is Guam like a business. We see revenues and expenditures. So I'm always weary about the tax credit issue because we can't follow through of it. But there is, as an alternative to tax credit, has GMH or GITA and or the governor's office considered identifying funds that may be available to support debt service for a line of credit or a loan of up to 25 million to pay for much needed medical equipment as authorized in section 80109S of Chapter 8, Title 10 of Guam Code Annotated. Have you looked into that, Lillian, at all? Had the possibilities on other sources of funding for a line of credit?
We have, and we are aware of that, but we're trying not to use that.
Okay. Okay, well, that's all the questions I have. Thank you, Madam Chair, for the opportunity.
Thank you. And we will clarify with legal and we'll share that with the committee. Of course, we also want to find out, if the donation to the nonprofit, the company takes a tax, break on that donation if there's any double. But okay, so thank you, Senator. And next we have Senator Muña.
Thank you very much. And thank you again to Director Posadas for being here, Administrator Posadas for being here. We understand you're very busy and there are a lot of better things that you could be doing right now too. So thank you again. I'm just basic. So if I'm to understand correctly, we already have the electronic health record system already being taken care of. So this bill won't apply to that. Okay, so it's specifically for equipment then. And then the way I'm understanding it, according to Senator Shelton's explanation, is that for an example, if a nonprofit organization purchases the equipment for GMH, for example, so where they purchase it from, would that be where the tax credit is going to come from? So is that what she means by, is Senator Shelton, is that what you mean by the pass-through?
What I mean by the pass-through is that if the hospital chooses a not-for-profit organization such as the Guam Memorial Hospital Volunteers Association, then the Hospital Volunteers Association will be the entity to make the purchase of the equipment for the hospital.
Okay, and so then who would get the tax credit for that? Would be the hospital?
It would be any private business or company that can receive the tax credit.
Okay, and who would be the one to choose that?
Well, it would be administered by GITA.
By GITA, okay, okay.
And that's
Okay,
why
I'm
there
just-
is an appropriation or a set aside for the Guam Economic Development Authority to administer the tax credit program here in the bill.
Okay, yeah, I'm just trying to see how the process would be and how it would go through that, because I fully support GMH. I fully support all of the nonprofit organizations that support GMH, and I want to make sure that we're doing it the right way and that everybody somehow, it's all a win-win situation. Yeah, I think this is a good thing, and we do have to be cautious again, but I still think that I support this bill and where it's going and who it's going to help support. Thank you again. Thank you, Madam Chair.
Yeah, Senator Moreland.
Thank you, Madam Chair. I have no questions. Thank you.
Thank you. Speaker Munya Barnes.
Thank you, Madam Chair. I too just want to thank the author for giving me the opportunity to be a co-sponsor and working closely with GMH as they continue to be the front line for a lot of things in our community. And I just want to say that I don't have any questions at this time. I understand the intent of the bill moving forward, and I think this is one great way to help the hospital. So thank you, Madam Chair.
Thank you, Speaker. Senator Kelly Marsh-Titano.
Seduis Masi, Madam Chair. So, along with the others, definitely we want to help out the hospital as much as possible. It benefits the entire community if we can find means to be helping the hospital update its equipment and so forth. So I appreciate the questions and discussion that have occurred already. And the one area that I was looking at was just to make sure that the section there for GITA to potentially, let me get the wording correctly, but to potentially collect a processing fee in order to defer the cost of administering the program. So the author of the bill mentioned that there is already a set aside. Do you see that this processing fee of up to 1.5% might need to be actuated? And if so, is it calculated? It seems like the other language in the bill is talking about the tax credit being applied specifically to the cost of the item, including the transportation of the item. So just to make sure that everything meets its intent, I want to make sure that the 1.5% is calculated in somewhere so that if there is that need, it can be compensated. GITA can be compensated.
Sure. If I may, Madam Chair. Thank you. Well, I think in the fiscal note provided to us by BBMR, they did mention that the cost to GITA to administer the tax credit program would be between $8,000 to $10,000 annually. So at the most, at the 5 years of this program being administered, it would be $50,000. And so it would only be actually 1% needed to be authorized. So I would support that amendment to the bill to change it from 1.5 to 1% to allow them to administer the program as it's estimated here by BBMR.
Okay, and like I said, just wanting to make sure that the language when it discusses the cost of the equipment and the cost of the transportation, that it is also making sense across the board, that it can also be applied to this processing fee. Do you happen to know for this year what the set aside is for GITA to administer the tax
Sorry.
credit?
What I meant by set aside was that within the bill, we already carved out the 1.5% for GITA. Yeah, not an exact amount, but that the 1.5 was already written into the bill. And then BBMR gave us this additional information that said that the estimate would be $8,000 to $10,000. So a little less than 1.5%. Mm-hmm.
Yes, and I did catch you mentioning that earlier. Okay, so yeah, I'll continue to look at that, and Therese Masi, Madam Chair, for allowing me to ask that question.
Thank you, Senator. I'll now ask the sponsor to close on the bill, Senator Shelton.
Thank you very much, Madam Chair. And again, thank you for taking the time to hear this bill today. As was mentioned, we introduced this bill before the pandemic hit, before we knew any of this would be happening. And as the bill is written, it will not be effective until October 2021, as to not interrupt anything within this year's budget. And hopefully that allows us some time to realize what the real effects of this kind of tax credit can be. And we have spread it out over a 5-year period so that the impact is not so great within any given year. So to give an additional $1 million every year to the hospital that, we can commit to them. As we know, the budget every year fluctuates, and if we can give even this little bit, an extra $1 million, we know that this can buy a couple of pieces of life-saving equipment. And if in the next couple of years we see a new hospital being built or a hospital being renovated, these pieces of equipment can move with them to whatever new facility or renovated facility that we have. And so I'm very thankful for you for allowing us to hear this bill, and I ask our colleagues to continue to support this and to support our only public hospital here on Guam. And I'd like to thank all of the people from the hospital who are here today, Administrator Posadas and all of your team, and of course, wish you all at the hospital good health and safety as you continue to fight for all of us.
Thank you, Senator. Thank you again to those who came to testify on this bill. We're trying not to bother GMH too much by requiring your presence down here. We keep waiting for a better time, but unfortunately, yes, that doesn't seem to be happening. So we're going to, for Bill 301, I'm going to consider this now duly heard by the committee. The time is now 2:43 p.m. So we'll move on to the next item on our agenda, which is Bill 305-35 COR, and I will ask Senator Moylan to introduce the bill.
Thank you, Madam Speaker. The topic was also already mentioned earlier, so just as a brief introduction, 305 is just an amendment to Public Law 33-143, which is back in 2016. It was an RFI that GITA put out there to look at the interest of management and operations of the Guam Memorial Hospital and present the summary to the Guam legislature. There was 3 positive replies for that RFI of the public-private partnership with the management and operations of GMH. And that was presented to the legislature back in the 33rd and the 34th legislature, but there was no action taken. So, but the constant thing here is that the concerns that brought about Public Law 33-143 was that there's no difference today in what we were experiencing then as we're experiencing now. And should the government basically continue to manage and operate GMH or go into a public-private partnership? And that was the essence of Bill 305 with the public-private partnership through a performance management contract, and which GMH would develop the RFP and forward to the Guam legislature for public input. And if enacted by the governor, then GITA and GSA would issue the RFP, and GMH would provide a summary to the Guam legislature for final approval. Some of the questions that may come up with this bill was, so what if we have a new hospital? a new hospital will be constructed. Well, the performance management contract could basically be transferable. But in the meantime, it's going to take a few years for our new hospital to be built and financed and actually open. So while current facility, we still need to address the operations and facilities issues, as we're all aware of, which has been the case for many years. Contract limits, of course, are the basic ones, the 10 years with an option of every 5 years, not to exceed a total of 20. And it also must contain a performance review and annually, otherwise they're subject to termination or penalty. And of course, we're not looking for any conflicts of interest in the contracts that are proposed. So I'm looking forward to comments for this bill, Madam Chair. Thank you very much.
Thank you, Senator Moylan. All right, so we have signed up to testify on this bill, Trustee Sarah Thomas Nedida, and also, of course, the CEO of the hospital, Lillian Posadas. Shall I have the trustee or Lillian? Sarah, if you're available, please proceed. Good.
Thank you, Madam Chair and members of the committee. My name is Sarah Thomas Nediduk, and I am here to testify on Bill 305-35, which is an Act 2 add Chapter 98 to Division 4 of Title 10 GCA relative to a private-public partnership for the management of the Guam Memorial Hospital. I have submitted written testimony, Madam Chair. I think it has been received, and I'd like to just do an overview or summation of that testimony. I have been on the board of trustees for the hospital for about 1.5 years now. And I have to tell you that I, like many other citizens in our community, we have been, very concerned about our only public hospital and if it's providing the services and in the way in which it should for the people of Guam. And as you know, we also are very much a part of the regional response to healthcare and closely connected with our other 2 hospitals. And so I accepted the role of being on the Board of Trustees because of my concern as a private citizen and as a person in the field of human services for the past 40 years. I have to tell you that I was quite impressed, relieved, consoled in my meetings and in my observation of how the hospital is running. It really is, I think, much different than what my perception was of the hospital and how it was ran in the past. I think one of the most important considerations is that the hospital did not have a board of trustees that I think was as participatory and supportive of the hospital as it is now. The folks that are on the board of trustees, several of them I have not met or worked with in the past. They are allied health professionals. They are health professionals. They are people from the private business sector. And of course, I represent, the private nonprofit and social service area. And there's never been a meeting that there wasn't a quorum, first and foremost. So the members are quite prepared, very interested. They ask good questions and never hesitate to be involved in the hospital in any way that we can in terms of policy makers, or not makers, but policy supporters and an oversight. We have the CMS visit last year. We had the Army Corps of Engineers. We were present for those. And I think that the hospital did much, much better than I think most people might have thought, that we're really in good shape. And so the bottom line for me is that the issues that might have been prevalent a couple of years ago when this idea was first brought up, are not the issues today. And I think that the idea of the legislature taking a look at the hospital is a very good one. And I commend Senator Jim Moylan for his interest in the hospital. And I appreciate that there's a public hearing on this. This is a good thing. It's not a bad thing. It's a good thing. But I don't think at this time a public-private partnership is really in the best interest of our public right now. I think it would displace our current workers. It would, I don't know what the cost would be to have a management entity come in right now. And I don't know that it is really the best way in which we should, as a community, come together to embrace our hospital and really move it forward. So we've made significant progress in this last year. And again, I think the most important considerations are first and foremost that we have a functioning board of trustees that every single month meets to review the financials, the operational issues, and to battle whatever kinds of concerns there are for the hospital. So I think that's important because that really shows citizen participation. It shows that our public is involved in looking at the hospital and making those recommendations to ensure that there is transparency, that there really is, in fact, the staff is really carrying out what its mandates. And we are holding on and doing very well with accreditation. And for those of you that know me, I'm an accreditation person, having brought the first nonprofit to accreditation on Guam. So that's really, I keep my eye on that. And it's been quite impressive. So, I really want to acknowledge the immense dedication of the administration, of the clinical staff, Lillian Posadas, William Kando, and Dr. Jolene Uggan, and everyone else that comes to that hospital every single day, especially during COVID, with all the risk of exposure. They have not taken down their standards. And in fact, they continue to work towards improvement of the work that they do and ensuring that treatment is provided to every person that comes through those doors. They're amazing. And I think talking about a private-public partnership is something that's already occurring. I mean, through our board. That is I think, a great model for how our community is engaged, constructively and productively engaged in our only public hospital. So with that, Senator Therese Terlaje, and for any of the other senators that are here, if there's any questions that I might be able to answer, I certainly will. And I really do look forward to continuing to work with the Guam legislature in identifying what those best practices are and what all those very creative ways that we can engage so that our hospital continues on this wonderful path towards improvement and responsiveness to our community's ever-changing needs. Sizos Maasi.
Thank you, Trustee Nedada. Thank you very much for your service to the board and to the hospital and for your testimony here today. And I also recognize the improvements in the board, their communications and their meetings. I think they've even increased their meetings during the COVID period now, so that they could be fully informed of not just all the regular business that they have to attend to, but the COVID business. And so I know it takes a team up there. So I want to thank you for your contributions to that. And that CMS had cited the board in the past, for its they have governance issues, and that a lot of that has been improved. So I just want to recognize that and thank you again. So now we'll recognize the CEO, Lillian Posadas, for testimony.
Thank you. Thank you, Senator, for giving us this opportunity. And thank you all senators also for being present here. And thank you, Trustee Sarah, for those remarks and for that testimony. And Senator Moylan, with all due respect, we object. We do not support this proposed legislation on several key points. First and foremost is that the RFP process that is delineated in this proposed legislation is not in alignment, not in accordance with the RFP procurement regulations. The board governing bodies do not write RFPs. It's the executive, the management of the agency that writes the RFP, and it doesn't go to the legislature. It gets published. The scope of work that is going to be then and the criteria for the vendors or for the contractor to submit their proposal. Then it gets reviewed by the panel of the agency, such as people here in the hospital, materials management, and the department that really will oversee the scope of service. And it doesn't go from the Board of Trustees to the legislature to the governor. That's not the RFP process, according to our procurement regulations. And then the second key point is that before an RFP is drafted and published, there needs to be funds certified by that agency. And so that's the second part of that process for an RFP. The third, that's very, very crucial, is that any time an agency proposes to do an RFP to publish it, the AG's office needs to be involved from the very beginning, particularly when the cost of a project or the cost of a service to be procured is going to be over $500,000. And I know that with trying to get a professional entity to manage the operations of the hospital and to maintain it, that's going to cost the hospital more than $500,000. And so that's the third key part in terms of an RFP process. And then the fourth one, again, is contracting and engaging a professional entity. That takes quite a bit of time for the leadership and the management to really define the scope of service, to define the criteria for what that proposal will look like for the panel to evaluate which offer, which vendor, which proposal best meets the criteria that the hospital is looking for. So those are the four key elements that, why we do not support this proposed legislation. Yes, we recognize, and as Trustee Sarah had mentioned, that, the management of the hospital does need a really high-level leadership, high-level experienced individuals, and the hospital has gone through many consultants trying to get people to come and manage the hospital. But, again, they don't own it. It's the hospital employees that own the responsibility. So we need to support the leadership, the executive and the management team and the staff to buy into then the success of making the hospital really high reliability, high performance. And so, again, for those reasons, we do not support this proposed legislation. Thank you.
Thank you, Ms. Posada, CEO of GMH. And now we will begin questions from the panel, beginning with the sponsor, Senator Moylan. Sorry, Senator Moylan, forgive me. Can I just double check if Dr. Jolene, if you would like to present testimony? I think I saw you did on and off earlier.
She's in between doing physical.
There you are. Hi, Doctor.
No, I'm listening. Sorry, I didn't realize that we were going into that second bill, so I was actually trying to say goodbye. But so I'm back on. I'm listening though. I'm listening. I'm working as I'm listening.
Okay, great. Thank you so much.
Thank you.
All right, Senator Moreland.
I'll let my other colleagues proceed, and I can go on for a closing after that and make my comments then. Thank you. Thank you, Madam Chair.
I've got Senator Taitekwi.
Just mostly, Madam Chair, for the opportunity, and thank you to all those who testified. And I know Sarah, I've known her for many years, and appreciate you stepping up to the plate and working on the Guam Memorial Board of Trustees. I noticed that you signed it just for yourself, so this is not the intention of the full Board of Trustees. You're just coming on as yourself, as an individual? Sarah, are you there?
I'm sorry, Madam Chair or Senator Tello.
Multitasking.
Yes, I am. I am. I apologize for that.
No worries.
Can you please? Can you repeat your question, please?
So the question, Sarah, is that you're writing this letter on behalf of yourself. I noticed you sign it as yourself, and this is not the reflection of the whole board as an entirety.
I would say that we did have a discussion about it, and these were generally the sentiments, but I did present today as a private citizen. And of course, you know, with the knowledge that I am a member of the Board of Trustees. But we had dialogue about this bill, and I believe that they share similar sentiments. And I think, you know, what we should do is send an official testimony from the board on the bill. I think that would be, you know, that would be a good thing to do. So thank you for.
I'm sorry, Sarah. You're really breaking up when responding, but from the gist of it, I think what you're saying is that you're going to provide something on behalf of the board, if I'm not mistaken.
Yes.
So.
Yes, that's
their
correct.
Discussion. Yeah.
Thank you.
Okay, I appreciate that. I do appreciate that because, you know, if I'm not mistaken, this initiative happened in the previous administration, and they should try to move forward to find a solution for our only public hospital. And, you know, it's been 40 years plus, and we still can't seem to get a grip. And even though I think people prior that worked on the board as well as in the hospital, they've done their best. And I think that we've had some really good individuals coming up with great ideas, but unfortunately, it needs a collaborative effort, and that means from the administration as well as the legislation for everyone to really come together and make this hospital a safe #1 hospital, one for not just our patients but our employees as well, and to provide the necessary equipment needed for our doctors to do with the little that they have already. So I think this is an incentive and an initiative that I think we should, Madam Chair, look into the possibilities. We also have to identify what is exactly does public mean as part of public-private partnership management. Does it entail facility, equipment, non-management, personnel? I mean, whatever direction we should take. I think we should take a direction because nothing has been working. And to really get to where we actually our people deserve in their only public hospital. Other than that, if like my bill that was a task force with funding, by the way, that task force had funding to sustain it, to come up with an idea on a new hospital and where should it be and how many rooms and things like that. I think this is an opportunity to just go down this avenue to see the possibilities and not to, just throw it out the door and say it's not, because it's obvious it's been thought about and thought about in the past. I I support this measure. There may be some amendments in there to allow for us to really look through this bill completely and find a win-win for everybody. And like I said, we needed a collaborative effort between the administration and the legislature and the hospital in order for something like this to work. So thank you again for everyone who testified, Lillian, for all the hard work. Dr. Uggan, it's very good to see you. I'm glad you did get to stay to listen a bit. So thank you. Thank you, Madam Chair.
Thank you, Senator. Senator Muñoz, you are recognized.
Thank you very much, Madam Chair. And definitely, this is a great opportunity for us to actually move forward or even just to discuss the opportunity. Everyone knows that GMH needs all the help that they can get. And I think even everyone at GMH knows that they can use all the help that they can get. It could open up some doors. We don't know. I was reading the bill thoroughly, and it did mention that it would be GMH that would be the one to prepare the RFP for the public-private partnership. So everyone will have an opportunity to be a part of this, including the administration, the legislature, and definitely, of course, GMH. So it is an opportunity for us to open up that box and see if there's anything in there that we can do to improve all or some of the services, just the basic services that we can have, like maybe even just however way we can do it. So I look forward to some more of the discussion and see if there's any other ways that we can improve this bill. Thank you, Madam Chair.
Thank you, Senator. Legislative Secretary, Senator Amanda Shelton.
Thank you very much, Madam Chair, and I appreciate everyone again from the hospital being here to give your thoughts on this bill today. As you've all mentioned, I do also have some concerns with this, as it is our only public hospital, and but I am eager to move in a direction that assists us with solving some of the issues at the hospital. And so I remain open to some further discussion. I look forward to the information that you'll provide, Trustee Netadog, from the board, and just listening to how we can continue to find a solution that we can all come to terms with and build consensus on that works for everyone here in this situation. Thank you very much.
Thank you, Senator Shelton. Speaker Tina Muñoz Barnes.
No questions at this time, Madam Chair. Thank you.
Thank you, Speaker. Senator Kelly Marsh-Teitzeno.
Siduous Masi, Madam Chair. And, I have appreciated hearing the testimony, and I also look forward to hearing further from the board. What the community needs to hear, and what the community needs to hear is about the progress. And with Sarah Netadog reporting on that there has been progress, so to hear from the board in a more formal way about what they feel the progress is, and maybe what some of their further needs are, so that we can continue to look at this and see, as was mentioned, what are possible solutions. We all have to be creative. We all have to be thinking out of the box sometimes, or looking at it from every angle. And so I continue to want to do that, because we do need to be moving forward for the community. So I appreciate this dialogue, and I look forward to it continuing, so that we are indeed making sure that we're moving forward for the community. Siduous Masi.
Thank you, Senator. I just want to note for the record that, so we did receive a just going up from BBMR. It stated that it had requested information from GMH, did not receive information. So absent any information from GMHA, the Bureau is unable to determine the overall impact the government of Guam may face. However, the Bureau notes the following potential costs. 1, the RFP for the PMC should GMHA need to hire a consultant to assist in establishing the performance standards and planning for the private management contract. 2, payout of annual leave payments for outgoing GMHA management, and 3, potential departmental and or divisional reorganization costs. So those are some concerns that they had. I have no other questions, so we're going to go to the sponsor. But before we do, if I could just recognize at the board meetings that I've listened to recently, amidst all of this other stuff, we've got GMH receiving an AGA award for their, what are those called? Lillian, maybe you could remind me the
citizen-centric report.
Correct. I keep thinking of the graph, the citizen-centric report. Thank you. And I was there when Dr. Jolene Uggan reported that she and her team had come up with a protocol that they were very proud of that has been put in place. And maybe Dr. Uggan, if you could just describe that to them. I do agree that the more the public hears about GMH's progress, the better for everyone. Thank you.
I agree. Senator, which protocol? So we've actually we've written for COVID specifically. We've actually written about 50 protocols. And our protocols are designed in the clinical arm to increase safety. It falls in line with GMH's mission, which is providing quality care in a safe environment. It is for both our staff as well as our patients. We evaluate the current literature, and unfortunately, COVID is very new. And so we're constantly doing literature searches to try and keep up to date with the latest management for COVID. We create our own protocols so that they fit within our organization. We meet daily, mostly. We're very proud because our group is actually, the formal name is the Clinical Emergency Preparedness Team, which for the very first time, we've actually created something official. This was passed at the BOT last night. It's gone through all committees. The idea of this team is at the discretion of our CEO to launch this emergency team depending on the disaster that the community is facing. COVID has been, unfortunately for us, an ongoing disaster. And we continue to work until our CEO basically decides that the SEPT can rest. And we're hoping that with the vaccines, that'll come soon. But that's the type of work that we've been doing pretty aggressively. We work very hard. Our team is made up, it's very multidisciplinary. It's made up of physicians, professional support staff, as well as nursing.
Thank you,
Doc. And that's what
you
were talking about.
Yes, that's what I was talking about because it was meetings. Yeah, so and so thank you very much again. And we've heard you on the radio, so we know you're facing many different issues up there, and but all of you, I want to commend you again. And
thank you.
Yes, and to all the board as well. Okay, so Senator Moylan, on the bill, please, you may close.
Thank you, Madam Chair. Thank you to the presentation, especially to GMH staff, the doctors there for your service, and especially your time today by adding some input into this bill to include the board with Sarah Netadog too. Just some quick notes there, but the AG's office is involved in this process, and there are actually several other layers introduced in this bill for additional public hearings as it will by moving forward for this bill for more public input as well. I do appreciate all the accolades that Sarah did mention, and I don't discredit any of them, and you have a tough job, and my position here is to make that easier, not any more difficult than it is going through right now. I think what this bill is really looking at is the longevity of GMH, the survival of GMH, and how it would be not necessarily in this administration or the following, but in the long term for our children. And maybe that's something we can look at in that direction as this goes forward. But all your input is very important. And I'm sure with this committee, we can do some adjustments to this bill to make it even stronger and a better hospital for the people of Guam. All right, thank you, Madam Chair. Thank you again.
Thank you, Senator Moylan. And there being no further testimony on this bill, the committee considers this bill duly heard. It is 3:15 p.m. and that was Bill 305. Okay, now we're going to move to Bill 303. This bill, and I want to thank Public Health who has been waiting for testimony on this bill after we rearranged the order of the agenda to expedite GMH so that they could get back to their duties. So I just very much want to thank those from Public Health who've been waiting very patiently. Thank you very much. And so we will begin by on Bill 303, if allowing Senator Muñoz, who is the sponsor, to introduce the bill. Thank you.
Thank you very much, Madam Chair. This Bill 303 is an act to add a new subsection 3707 to Article 7, Chapter 3, Title 10, Guam Code Annotated, relative to creating the Guam Medicaid State Plan Advisory Council. A Medicaid and CHIP state plan is an agreement between a state and the federal government describing how the state administers its Medicaid and CHIP programs. It gives an assurance that a state will abide by federal rules and may claim federal matching funds for its program activities. Bill number 303-35 does not require Department of Public Health and Social Services to do anything different from the processes that they have been already having in place for decades, except that it will allow providers to observe the process and offer some suggestions. When I first became a senator, I was under the impression that the Medicaid state plan was created by the federal government for each state and territory and not by the states or territories. I talked to others that in the healthcare industry also that were not aware either. This tells me that there could be a lack of transparency in the creation of the Medicaid state plan. Now, understanding why this bill is important now is really not rocket science. It's the simple reason of money. Prior to 2009, Guam got around $15 million annually in federal Medicaid funds. With the enactment of the Patient Protection and Affordable Care Act, or also known as Obamacare, Guam was able to access up to $47 million annually from 2009 to 2019. In 2019 to 2025, that amount was raised up to $127 million annually. Additionally, the federal matching assistance percentages, also known as the FMAP, has been increased from 55 to 83%. This means that Guam's matching share is reduced from 45% to 17%. Now, it's no secret that the two biggest problems that Medicaid providers, both public and private, face are number one, low rates that are often below costs, and number two, slow payments of Medicaid billings. These factors are also some reasons that some providers don't accept Medicaid patients. Public, including GMH, and private providers will be able to offer suggestions on how to improve the process if this bill becomes law. That's all this bill is intended to do. The Medicaid state plan preparation should be open to the public, especially those responsible for healing the sick. Medicaid is not a simple program to understand. I won't even try to explain it here. The statements in the legislative intent of this bill are taken directly from the CMS website, and they can be read at any time. It contains complete information on what must be included in the Medicaid state plan and how to amend the plan if necessary. All this bill does is open up the creation process of the Medicaid state plan to the public, most especially the providers. And I really do want to thank, Tess Archangel for all of her hard work. And I'm sure, she lives in this process day in and day out. I'm sure maybe even close to some of every single waking hour of her, every waking moment of her life. And so maybe this might be an opportunity for her to just breathe a little bit and get some, advice from some of the other providers. So that's basically really what this bill is all about. And I really look forward to the discussion and see if there's, any other opportunities we can to improve it. Thank you, Madam Chair.
Thank you, Senator. I'd like to recognize that we have with us today the Deputy Director of the and Social Services, Ms. Lauren Duenas, and we also have with us Therese Archangel. So I think, we also have with us Dr. Suzanne Kaneshiro. Thank you for being here. So which of you is going to testify? Would that be Ms. Archangel? Please state your name and position for the record, please.
Okay. Good afternoon, Senators. My name is Maria Teresa Archangel, Department of Public Health and Social Services Division of Public Welfare Chief Administrator. And I'm testifying on Bill 30335 on behalf of our Director, our Deputy Director, on behalf of the Department. The Department supports the intent of Bill 30335. However, we would like to provide some comments. The Medical Care Advisory Committee is stated on page 9 of the Guam Medicaid State Plan, and it was approved effective April 1st, 1975, and it hasn't changed, it's still there. The 42 Code of Federal Regulations Section 431.12 stated the federal requirements for the Medical Care Advisory Committee, the purpose of which is to advise the Medicaid Director about health and medical services. The CFR specifically stated that the committee must include the following: board-certified physicians and other representatives of the health professions who are familiar with the medical needs of low-income population groups and who are familiar with the resources available and required services for their care. It must also include members of consumers groups, including Medicaid eligibles, recipients, or beneficiaries, and consumer organizations such as labor unions, cooperatives, consumer-sponsored prepaid group practice plans, as well as must include also the Director of the Public Welfare Department or the Public Health Department, whichever does not head the Medicaid program or agency, which means as long as it's not the Medicaid Director. Therefore, in accordance with the requirement of CFR that I mentioned, the bill must not only include members from the healthcare professionals or those affiliated to healthcare clinics or facilities. The federal also required committee members from the consumers groups. Therefore, our suggestion is to remove line 11 to 17 on page 6 of the bill to allow the Director of Public Health to appoint the additional members based on the CFR requirements for the committee to provide an effective and impartial recommendations. Furthermore, we would also like to suggest for the term limits of the advisory committee members be specified on the bill. Additionally, on pages 6, B1 and page 7, B2, 3, 4 of the bill, the program name Medicare, should be replaced with Medicaid, because the Medicaid become Medicare now. So they just have to replace that. So that's our comment. And also with regards to what Senator Muñoz stated, that the funding of Medicaid annually is 127 million. No, that Public Law 11694 is only for 2 years. It's only for fiscal year 20 and 21. Yeah, and that 83% is only also for fiscal year 20 and 21. So we're going to wait for fiscal year 22, whatever comes with regards if they're going to amend that bill or do an extension of that public law or do an extension of that law. That's our testimony, and thank you for giving us the opportunity.
Thank you very much. Thank you very much, Ms. Archangel, and thank you again for your work. And is there anyone else from Public Health who would like to testify? All right, if not, we'll recognize Dr. Nathaniel Berg. Dr. Berg, you may have the floor. Sorry, Dr. Berg, we can't hear you.
No, I apologize. I clicked on the wrong thing. Sorry, I should have been ready. First of all, thank you very much, Madam Chairwoman, and also Tess. You never can say too many good things about what Tess does for this community. And tireless is, I think, the best descriptor of her. She just keeps going and going and going, despite being 24/7. I think she actually has found the 25th hour in the day by the amount of work that she actually does. So Tess, respectfully, I will just give my opinion because it's maybe slightly different than yours, but I'm absolutely certain that there is a way to find a good match for this committee. I think we're all in agreement. If we'll notice that Tess did not oppose the bill in general, that we need to have a good working community with regard to constantly reassessing our needs for the indigent population. And so this bill is a great bill, and I thank Senator Luis Muñoz for sponsoring this bill, and I think it'll go somewhere towards effectuating better care for the indigent population on Guam, no question about it. And I think one of the intents of the bill is going to be very clear, which is that right now we don't have enough people taking MIP and Medicaid, and I think that this will go somewhere towards addressing that. All right, now, so I think it's the makeup of the committee that is going to be the challenge. If you have too large a committee, it will become unwieldy, as they say. There'll be too many people with input, and the messages will get lost. If you have too small, we're missing input from people. So, for example, I think the pharmacy board, and this is with all due respect to pharmacists, you have to say, necessary, or can they come and provide input, be invited to come and provide input as opposed to being members of the board? Should the director of public health be on there? That's an easy one, right, for me. When I look at the list, and I might also say I spoke with several colleagues regarding this, including Dr. Michael Cruz, and we kind of whittled it down to those whom we think are critical, and then the rest may be advisory members and have, if you will, an open invitation and be notified of the meeting, but maybe not voting because we want to keep it, not we, but I'm asking the legislators, the senators, to maybe keep it to as few as 8 or so. And we thought that would be, if this is again just my food for thought for the senators to consider, would be to have, and again, sort of a bunch of physicians. Maybe I spoke with the 10 physicians regarding the makeup to try and so that I could say that I was fairly representing at least some. They thought the director of public health would be a member, but be the chair, and he or she would not vote because, and Tess had mentioned that the Medicaid director should not be in charge, but the director of public health kind of oversees that stuff anyway. So we thought it'd be better that that person be the chair, because that person is in essence overseeing the program, and or maybe de facto, even if it's not the true head of the thing. So be the chair of it, but not be a voting member. And that would leave, again, just our recommendations would be to say, to have the CEO of GMH, the CEO of what you might define as any private hospital in Guam. I think we all know that I'm saying GRMC right now, but we're another private hospital to become a real hospital. And maybe you define it as having a minimum of 30 beds or something, whatever that the senators thought appropriate. But the CEO of GMH, the CEO of any real private hospitals, I think the head of the nursing board, and the reason the nursing board is you have nurse practitioners who are involved in care and oftentimes for whatever reasons are involved more with indigent care, perhaps on a percentage basis than physicians. The Allied Health Board, we think also because there are physician's assistants and podiatrists, at least currently. on the board. There has been a proposal somewhere to have both of them move to the GBME, but nonetheless, I think the Allied Health Board also has chiropractors and psychologists and others, so it's appropriate to have the chairperson also. And then, and the reason, by the way, is it should be that those members, the heads of those boards should have significant regulatory experience. They might not all, but they'll develop it. And they all, the de facto members of the chair will typically attend the National Board of Nursing meetings. It's usually one person, it's usually the chair. Like for example, myself, I attend the Federation of State Medical Board meetings. And I don't know about the Allied Health, but certainly the Nursing Board does, and there's even a meeting of all of us. And then we think that the private clinics should not be appointed by public health, but rather should be appointed and confirmed by appointed by the governor or proposed by the governor. I'm sorry for the lack of the correct word right off the top of my head. Nominated by the governor and approved by the legislature. And we think it should be left as generally, this, by the way, gives the legislature some voice in who's there, although they also would have been involved with the selection of the board members, but also that it not be defined as larger, that it be vaguely defined, if you will, as large and small. We all know what it means, and part of the reason I do that is so that the legislature would not have to update the financial component of that, 5 or 10 years from now, that it just stay as larger clinic and smaller clinic. And I agree with the language that it be board certified simply because that is mandated in CFR. Their members of the legislature may or may not know that that's not an in favor term out there, but it's not up to us. Because when I had pointed that out, because I had reviewed that in advance and saw that, and people don't like that. They'll say, well, somebody is board eligible or their board expired. And indeed, that happens. People specialize and they never go back to get their board certification within the general specialty. And that's bad that those people can't be involved. But until that's changed under CFR, we don't really have a choice for now. In other words, we don't want the state plan to be rejected because we didn't comply with the Code of Federal Regulations. So that's our proposal, is that it be that those be the members, and that would be an 8-member board chaired by the chairperson of public health, who is non-voting. But otherwise, I like this a lot. And I will say that the general consensus of the healthcare providers that I spoke to, weren't all physicians, I might add, was that best that it mirror, once in place, and this is, again, I'm just sort of planting the seed, that the regulations, for example, for screening or for eligibility of certain procedures, mirror Medicare to the extent possible and follow the screening guidelines of the United States Preventative Services Task Force, because they can be, the Preventative Services Task Force stays up to date. Oh, thank you very much. Sorry. What am I signing? Oh, sorry. I apologize. Patient care first. I just got to get an order here. Okay. Thank you very much. So they can do it. May repeat. Okay. Thank you very much. Sorry about that. Okay. Thank you. That if we can, to the extent possible, again, the rationale behind saying larger clinic and smaller clinic would be that we could mirror Medicare, would allow that's updated every year, and experimental things or things that are no longer applicable, that they archaic procedures and the like, that they not be done and not be approved automatically as Medicare goes through it. We already have, if you will, really robust organizations that are helping to determine what is appropriate care and what's not appropriate care, especially for the elderly, but actually Medicare covers everything. And then also that the Preventive Services Task Force is updated on an annual basis. I don't always agree with what they do, but I think it's a generally respected organization within healthcare to determine what is appropriate for screening. So with that being said, I think that's enough, but I appreciate your time and allowing me to provide testimony.
Thank you. Is there anyone else who would like to provide testimony? If not, then Senator Muñoz, you may ask questions on the bill.
Thank you so much. So I have a couple of questions. So Ms. Archangel, you mentioned term limits. Like what are your recommendations for term limits for this advisory council?
Term limits of 2 years.
2 years, every 2 years. Okay.
Every 2 years, yeah.
Okay. And then also, so I was just taking notes, and I was trying to take notes as fast as Dr. Berg was talking. I'm learning how to do it. You did mention that you said 8 members, right? So I'm just going to kind of go through it, and maybe I'll just review your testimony again after this hearing. But you mentioned the Director of Public Health and of course the GMH hospital. And so that's 2. You mentioned the Board of Medical Examiners, that's 3. The Allied Health Examiners, that's 4. Then the 5th one would be for the private clinic or hospital, which would be GRMC, that's 5. You mentioned the nurse practitioner board, chairperson for nurse practitioner, 6. Podiatrist board as well, that's 7. And then you said an 8-member board. So would that 8th member be like maybe the member of the legislature or the chair for health? I'm not sure what the 8th member was.
Senator?
Senator?
Yes.
Senator, it's specifically stated on the CFR that one of the members must be from the consumers group.
From the consumers group. Okay.
Yes.
Okay. So we have to include that too as well. Okay.
You have to include that. Yeah. And of course, the director of, it says Director of Public Welfare Department or Public Health. So that means the Director of Public Health. Yeah.
Okay. Okay.
So Senator, I apologize, but because you're absolutely correct. I talked very quickly. I apologize. And I'll also apologize for not providing written testimony, but I promise you I will follow it up with written testimony. So I'll just, and I think, Tess, I apologize. You're right. It needs to have a member of the public. So,
yes.
So that would be a 9-member board with the chair of public health, the CEO of GMH and any private hospital, the chair of the Guam Board of Nursing, the Guam Board of Medical Examiners, and the Guam Board of Allied Health, which includes the podiatrists and PAs. So I apologize for not being clear.
Okay.
And then I felt that it would, or not I, that was the consensus was 2 physicians. Again, this is per the CFR that there'd be physicians, 1 from a larger clinic, 1 from a smaller clinic, and then we'd have to add a member of the
consumer
private of the public, if you will. Then maybe the Director of Public Health could be a tie-breaking vote, only vote in the setting of a tie, right? So, but I appreciate it, Tess. I apologize for excluding the member of the public as well.
Yes. Okay.
Okay, so I was just taking down notes, and I'm sure we can work together with the chairperson for health and kind of solidify that list and make sure that it's conducive to what is required, first of all, by the feds, and then what's recommended by the board. Thank you, Madam Chair. That's all the questions that I have right now. I don't know if I may come up with another question in my closing, but as of right now, that's all I have. Thank you.
Thank you, Senator. So, Tess, may I ask you a couple questions? Who, the CFR, if you could just state that reference, what is the citation again?
It's 431.12, section 431.12, 42 CFR. Section 431.12. It's specifically stated there, the basic purposes, the state plan requirement, and everything. I can email it to you, senators.
All right, thanks. We're going to include that in our committee report. That's why. And so what do you currently do? Do you have an advisory input right now? You haven't established that?
No, we depend on what CMS suggests, because eventually they're the one who's going to approve it. We do a public notice. So based on what the public suggested, we presented to CMS, and so they gave their opinion. And so based on that, we amend the state plan. And of course, based on the funding that we have. Yeah, we cannot just always add and add and add, and we don't have any funding to cover the services yet.
Right. So you're trying to
Because
balance.
we have, because we have to provide the cost impact for each.
Okay,
And if the government can support it.
Okay, great. So I'm sure there's a advocacy to include different types of services that they be covered,
Yes.
right?
Yes.
And that, of course, take away from what you're currently spending on to spend on those instead. And I've seen, correspondence back and forth. For example, with GRMC, they don't agree with the state plan rates that they are being allowed.
Actually, the advisory is actually to add medical services, health and medical services. When it comes to payment, it's based on CMS. We don't control that.
Okay,
Yeah.
CMS.
It should not be above the Medicare upper payment limit. So we don't have control over the reimbursement rates.
Okay, so in your state plan, you don't control that. Okay, so CMS does that.
no.
But Medicare. What about
CMS?
Right. What about when you? I guess when will you be finalizing your 2022 plan, state plan?
The state plan is only amended if we want to amend it. If we don't, then it doesn't. But we did increase the fees. We increased the fees of the physicians by 10% as a result of this COVID. We increased it by 10%, including the hospitals, as long as it doesn't go beyond the upper payment limit.
All right. What do you mean that you increase the fees?
We increase the physicians' fees,
right. But earlier
to 10%, effective April 1st, until this COVID is, until the public health emergency declaration. But we intend to increase it even after the public health emergency.
And does that require?
We are in the.
Does that require an amendment to the state plan then, or not?
Yes, it requires. Yeah, I did 2 state plan amendment, one to increase the income guideline and one to increase the physician fees.
Yes, could you describe the amendment that you did for the income guidelines? I understand that's going to allow a lot more people to qualify.
The income guideline doesn't change. It's actually based on fiscal year 2016 federal poverty level, but 109% of that because of the funding that we have. We cannot just drastically increase the income guideline and have everybody qualify under the program. And so the liability is on the government then. So, but we can increase it based on the funding that we're receiving and based on the local appropriation that the legislature is going to provide. Because even if we increase it, even if the federal, if the feds increase the income, the budget or the funding, if we don't have the local match, we won't be able to draw it down. So it's still the same. Even if they gave us 200 million, if we can only match it with 10 million, that means we can only draw down based on the local match that the legislature or the government provide. Yeah, that's the issue there. That's why we kind of need to assess the cost impact, the Medicaid, as well as to the government.
All right. So what is your the proposal that you are either sending in?
We propose, actually, we're proposing to continue the increase of 10% and to expand that not only to the physician services, but for other services as long as it's below the upper payment limit of CMS.
All right. And what about the poverty level?
The poverty level, we intend to increase it, just make it to increase on a yearly basis based on the federal poverty level, because if we're going to base it on the current poverty level, of the 48 contiguous states, then it will be 133% of that, or 138% of the federal poverty level. If we're going to follow, because currently we are using Guam poverty level, which is based on fiscal year 2018, 109%. That's the increase from the FY 2016. And if we want to increase that, if you want us to follow the current federal poverty level, then we can do that for fiscal year 2021. But we need to assess the cost impact. Okay. And if the government can provide the local match for those.
Right. Yeah. I think you should plan for the government to provide the local match. We cannot.
Yes.
Yeah. So,
yes.
and as you described to us earlier, if they take the prior appropriations or the lapses or even the bills that are being considered, they should be able to do that. Okay, so back to this council, we need to follow the CFR first and foremost, and then other than that, we can run the bill. All right, thank you very much. All right, so next on the bill is, sorry, my list is here. Senator Taitigui.
Thank you, Madam Chair, for the opportunity. You know, I don't have any questions at this time. I'm just listening to a lot of the information that Tess Archangel has. She's always been my go-to girl when it comes to Medicaid, Medicare, and CHIP program to kind of understand it. I mean, from what I gather, this is something that you already do in your capacity to come up with these regulations. And I guess it's just something that could be, you know, this bill would bring more people to the table and bring a different perspective, I think, a broader perspective than what you're already doing right now. So looking forward to hearing the rest of the comments being made on it. And thank you, Tess, for being here. And Dr. Berg, thank you, as well as Dr. Kaneshiro. Appreciate you still being here. Oh, and Deputy Director Therese is still here all day. Thank you so much. Okay, thank you, Madam Chair.
Thank you. Speaker Munya Barnes.
No questions at this time, Madam Chair. Thank you very much. Appreciate it.
Senator Marsh Taitano.
Sedus Maasi, Madam Chair. And I just want to say that I really appreciate Senator Munya. She's been consistent in taking these deep dives into these critical areas of healthcare and some other issues as well. And I've been told that, you know, it takes quite a bit of dedication and time to really understand these issues, to be able to address them. And so again, I really appreciate it. And so with this, I mean, it sounds like she's worked very closely with Ms. Archangel, and it's receiving a lot of support and is felt to do very good things. So those are all very good for us to hear. And I apologize, I was a little bit distracted. We had a pipe bust over here and it created a small geyser. And so my time was a little divided. So I hope I don't repeat anything, but so I did hear the part where they discussed term length and that was looking at 2 years. And so I had also been thinking about a few other things. And so I may have missed, is there any recommendation, Mr. Archangel, as to how often they should meet? With an advisory group like this, you know, I think with the people that we're looking at today, we can probably feel pretty comfortable that they're committed, but maybe just for assurance, should we be having them meet at least once a year, or do you have any recommendations?
It's basically the Medicaid program is it has a comprehensive coverage right now. So it covers almost everything. Well, there are definitely exclusions, or there are like experimental drugs, it's not, those are definitely not a covered benefit under the Medicaid program. So right now, with regards to coverage, it covers everything. It's a comprehensive benefit. So
Yeah, I may not have expressed myself very well. Know how often this board would meet.
That's right. So if we're saying if the board needs to meet, I think if there is a need, then I think the chair should call for a meeting. Like for example, if they want to add or discuss something, there's new technology, there's new modality or treatment modality, I guess they have to meet and see if we can add that. If it's already part of the services, then there's no need. So it depends on the chair and the need. So I cannot say just once a year.
Right. So so you wouldn't be opposed to it saying at least once a year, and then as you said, then of course the chair can call people as needed. Yes. But we just want to make sure that you know, we don't know what the future holds for us, but we want to make sure that they do indeed meet at least once a year. Yes. And have some. So that's important to hear. And
Senator, what we can what we can do is if there are services that the healthcare industry or the doctors wants to add and it's not a covered benefit at the moment, then we can advise the chairman of the advisory committee to discuss it with the members. That's what we can do. So we can advise it because they usually give it to the Medicaid director if they have any questions or any benefits that they want to add.
Very good. And with the way that you see this board envisioning or operating, is it necessary to have any sort of, I guess, well, I was looking at two things, quorum and a vote process, because this is sending information on behalf of the island and it will affect the island overall. So since you're more familiar with this, does it make sense to have what is actually recommended be put up for a vote so that the majority of the body that are there, that there is some agreement? Or how would you see a good way for this to operate?
Just for clarification, even if the board voted and CMS says no, disapprove it, it's not up to us. So basically, they can suggest what we can include as a benefit, and then we'll submit it with CMS to CMS. So the approval is still with CMS, and it's up to the governor if she or he wants to submit it. So basically, we just prepare the state plan amendment. The governor will review it and her legal counsel. And if it's approved by them, we're going to submit it to CMS. And if CMS agrees with it and has no questions, or if there are further questions, we're going to go back to the advisory committee to clarify, to add more information to it before we resubmit it to CMS. So that's why it's an advisory committee. So
right, and so you're saying you don't think that there's any need to have consensus for the recommendations for the advisory board. There doesn't need to be any consensus that they all agree the recommendation is something good to recommend. You don't think there's a need to have any consensus there?
I think there is, especially when it comes to funding issue. Which one is more important to cover? As much as possible, we want to include all healthcare services. But I think the only reason why they need to vote is when it comes to funding issue.
Okay, and yes, you have the daily experience with this, and so that's absolutely why I wanted to get your input. Yes. And I have just one last question, and it may be the legal interpretation, and I know that the author works with looking very closely at legal interpretation, so maybe the author would be the one to prefer to answer this if she so yields, but I was looking at the language for the board, and where it said individually, sorry, let me pull it up. What? Oh. But anyways, it said that for the board, it could be either individually or as a body or something like that. And so again, just wanting to plan for the future so that everything works as smoothly as the intent is. Is there any issue with people being individually authorized to make recommendations or attend something? Is that something that you've thought about, or is that something that's already kind of addressed with how a council operates?
Thank you very much. Thank you, Senator Marsh Taitsino. That question was addressed for me. Is that question
Yes,
addressed for me? Oh, okay.
Yeah.
I think if you're talking about the section B, where it says the powers and authority of the council shall include individually or collectively the following. What it meant was not individually as a person. It meant individually as the following recommendations, to either propose recommendations or solicit recommendations or propose recommendations from the Mega Haga. So I think that's what it meant, either individually those sections or collectively those sections. So it's not necessarily a person alone that's going to make a determination.
Okay, and that's good to have that clarification because yeah, with the wording, I wasn't quite sure how to interpret it. Yeah. And you know, we all want to just make sure that things are as clear and clean as possible, so it meets its intent. So thank you for providing clarification there.
You're welcome.
So those were just the points that I thought would be good to get a little bit more detail and clarification on. So Sijus Mahasi, Madam Chair, for letting me ask. And thank you everybody for your time here today and for all of the input. It's been very helpful.
Thank you very much, Senator. Tess, to just clarify, so you said that this is a recommendation, this council would come up with a recommendation to the governor or to the Director of Public Health?
To the Director of Public Health. Basically, the responsibility is actually to advise the Medicaid Director. So whatever recommendations they have, the Medicaid Director will assess that and will refer it to CMS. Once the state plan is being discussed with CMS, then they're going to prepare the state plan, submit it to the governor for her approval to submit. Yeah, it's still the governor who's going to submit it. This is only, they are advisory committee members to advise of new health services, of whatever the community needs, if we have resources or we don't have resources. The Medicaid Director need this. We cannot just depend on the Medicaid Director to do everything and knows everything. So the healthcare professionals, the doctors, all this, they know this and they would know what's best for our population.
All right, thank you. And so the Medicaid Director, again, who is that?
Oh, we don't have currently the Medicaid Director. We have the acting Medicaid Director. There's two who's alternating. That is Janet Cruz and Jeff Santos.
All right, okay, thank you very much. All right, now we will allow the author to close on the bill.
Thank you so much, Madam Chair. And again, thank you, Tess, for all of your input and all of your work. I mean, I understand. I remember the very first time I met you. Everything that you said just felt so overwhelming to me. I felt your stress and just kind of going through the process of being working with public health and yourself, just understanding what we can do to assist you. And I think this will help alleviate some of that stress, allowing people to come in and help. help assist you. And then of course, thank you to Dr. Berg for being a part of this process as well too. I think if it's a 9-member board, or maybe even if we have a champion, someone like, our chair for health, Senator Terlaje, who is constantly fighting for funds for Department of Public Health, if we incorporate someone from the legislature like Senator Terlaje to go in there and be a part of this council too, to pound their fists and say, we need this money, because really, like you said, if we don't match, we won't be able to get what we are deserved. And so maybe that might be also another consideration when we get to discuss this bill on the floor, to have somebody within the legislature who is going to fight for that money during the budget process, just like Senator Terlaje. And so I look forward to the input and reviewing the entire committee report, and hopefully if we can get this on the floor, then we can help assist Department of Public Health in getting the funds they need. Thank you again. Thank you all.
Thank you, Senator Muña, and thank you again to the representatives from the Department of Public Health and Social Services for your work today and every day. There being no additional individuals to present testimony, the committee will consider this bill 303-35 duly heard. The time is now 4:01 p.m. We'll now move on to the final item on our agenda, and thank you all for your patience. This is Bill 414-35 COR, and I will allow the sponsor, which is Speaker Tina Muña Barnes, to introduce the bill. Speaker.
Madam Chair, for giving me the opportunity to speak on this bill. Bill number 414-35 COR is introduced by myself, which is an act to amend sections 19104, 19202A, and 19804B, and to add sections 19403B, 6, and 7, all of Chapter 19 of Division 1 of Title 10 Guam Code annotated relative to establishing limited liability to essential businesses and private and public sector entities under the Emergency Health Powers Act during a public health emergency. I'd like to thank my colleagues who are here this afternoon with me, as this is the last bill. I want to say that when I introduced this bill last month, Madam Chair, it was relative to granting limited liability protection to businesses that provide essential services to our island community through of course, the Emergency Powers Act. And if passed, Bill 414 COR will extend civil immunity to all critical businesses identified through an executive order or directive from the Public Health Authority. The purpose of this bill is to encourage proper adherence to public health guidelines, and in the absence of government enforcement mechanisms such as fines and curfews. I believe that the provisions contained in Bill 414-35 COR, such as sections 19804B5, will ensure that the immunities granted under this bill will only apply to entities that are in strict compliance with our island's health directives. As it stands, Madam Chair, many of our local businesses are shut down because of the carelessness of some of our members of our community. However, the vast majority of our local businesses are doing everything they can do to provide a safe environment for their employees and their patrons. So for many business owners and employees, their work is their bread and butter, and they should not be forced into financial ruin, nor should our community pay the price if they are closed down. I authored this bill in the spirit of Inafa Malik and hope that this will assist in a safe and reopening of our island community. And in the efforts of doing that, Madam Chair, it was brought up to me by several constituents in the community about wanting to make sure that when they open safely, that they don't get penalized for those folks who do sometimes recklessly don't follow the rules and regs, and why should they be penalized for that? But I want to note to you, Madam Chair, that there was a fiscal note that was attached to the bill, and If I may, I'll just read the notes, if that's okay with you. Bill 414-35 COR intends to amend various sections of Chapter 19, Division 1 of Title 10 Guam Code annotated relative to extending the limited liability provisions under the Emergency Health Powers Act during a public health emergency to essential businesses, private sector entities, and public sector entities as defined in the proposed legislation. According to the proposed legislation, this is to ensure that private and public sector entities continue to provide their vital services to the community by providing reasonable protections against threats of legal liability during a declared public health emergency. The proposed legislation intends to apply its provisions retroactively to March 14, 2020, in line with the ongoing COVID-19 public health emergency. Absent pertinent information from the Department of Public Health and Social Services and other related entities relative to cost associated with legal action taken against the government of Guam, or the potential savings to be realized from the extension of the limited liability provisions in this proposed legislation, the Bureau at this time is the Bureau is unable to determine an appropriate fiscal impact at this time. Madam Chair, the fiscal note also noted that there are multiple technical corrections that need to be addressed in the proposed legislation's current form, and I hope to be working closely with legal and of course your committee to see if any amendments, technical amendments need to be made. I also want to say, Madam Chair, that I'm very open to any recommendations. Again, this coming from a perspective from more than several of the business stakeholders out there, and making sure that some kind of protection is given to the businesses. I'm open to any recommendations, any critical critique that is put on this bill. I know that only 9 out of 50 states have done it. I know that there's more than 21 states that's looking into something closely like this. And I know that other jurisdictions, as it relates to the East and West Coast, are also revisiting this. Again, just a way to help protect the businesses that are out there literally trying to do and provide those vital services to the community, and without having to fear for any suits that are out there. So thank you for taking the time to listen to this bill, and I hope that the business community and my colleagues would be at least amenable to looking this measure over and seeing what we can do to at least make something work. So thank you, Madam Chair.
Thank you, Speaker. And again, thank you for your patience while we rearrange this agenda to get public health and Guam Memorial Hospital staff out as fast as possible. I very much appreciate your patience. And for the record, we did send notice of this bill to the Attorney General's office, to the Guam Bar, to the Guam Chamber, and to the Guam Hotel and Restaurant Association. So we will still accept testimony, and to Public Health, of course. And so Public Health, you're still here, and so I would like to invite you if you would like to present testimony on this bill.
Yes, my name is Dr. Suzanne Kaneshiro. I'm the Chief Public Health Officer, and I run the Division of Public Health at the Department of Public Health and Social Services. So before I start, I would like to ask that this bill be actually extended to the employees of the Department of Public Health, the health providers and personnel, not only just the businesses in the private and public sector. So we actually are asking for the department employees as well. Okay, so we are in support of Bill 41435. Okay, I have to read this if you don't mind. Effective public health responses to emergencies require timely, decisive, and sometimes controversial action by public health providers and personnel. Unfortunately, the perceived risk of litigation against them is likely to lead at least some public health personnel to fear that they are exposing themselves to the threat of lawsuits. The fear of personal liability might be especially prevalent during a public health emergency when the stakes of action and inaction are higher, information limited, and conditions for working and treatment are not optimal. A public health official who delays quarantine on groundless fear of litigation may risk the health of the entire community. Liability concerns may affect healthcare personnel working at isolation and quarantine facilities. Liability could arise from triaging decisions, choice concerning how to ration scarce resources, confidentiality breaches, or providing medical services without appropriate licensure. Healthcare providers might influence their willingness to participate in the response activities. Public health officials should be protected in their reasonable attempts to implement emergency measures and thereby immune from liability based on personal injury or property damage. Owners of property that is used by the government during a public health emergency should not be held liable for death, bodily injury, or other loss if their property is being used for the purpose of shelter, protecting, or safeguarding individuals in emergencies. Without this limited liability provisions in place, private businesses may not want to participate, decreasing the number of available properties that can be used and may result in higher costs for the government. COVID-19 is continuously evolving. What we are doing today to mitigate the spread of the exposure of COVID-19 may be different from what we will do tomorrow, which is the reason why we follow CDC recommendations to guide us. So what we were doing in March doesn't apply now, so because continues changing. So we're always constantly changing the treatment and how we approach responding to the response. So this bill is we favor this bill because it actually limits the liability on public health. So for example, the number of patients or travelers we see at the airport, everybody's different circumstances, so also in the quarantine, we see a lot of different treatment, different conditions. So we're always, it's a individual basis, how we decide on each person that's in the quarantine or isolation facility. So that's what we're saying. So we do the best we can because it is new. This COVID is new. We don't know. There's a lot of unknown. So we do the best we can with what we know right now using CDC guidelines. Thank you.
Thank you, Dr. Kaneshiro. Is there anyone else to testify on the bill? Okay, Speaker Munya Barnes.
Thank you very much, Madam Chair. And just to answer some of the support for Dr. Kaneshiro, I want to note that in this efforts, I think we included the public sector entity, which includes any political subdivision of the government of Guam or an agency, board, or commission, or department of the territory of Guam that is not considered a private entity. And if we need it further defined to include that, whatever provisions, I'd be more than glad to work with you, Madam Chair, on that inclusion. Thank you.
Thank you, Speaker. Anyone else to testify on the bill? All right, then if not, we will accept questions now. Let's begin with Senator, Speaker, did you have any more questions or?
I can wait to closing, Madam Chair.
Senator Taitakui.
Thank you, Madam Chair. I was so hoping the Attorney General's office would be here to clarify a couple questions I had with regards to the legality of this, especially on Section 6, where it retroactively goes back to March 14th. I'm not sure if that can be done, especially in any kind of lawsuit or anything like that. So I'm curious to see what the Attorney General, as well as the bar, the Guam Bar Association has to say. It'd be very helpful. Did we get anything from legal, our legal? Okay. So that being said, on page 5 of the bill, under the definition of essential business, it reads, any private or public sector entity identified by any executive order or directive from the public health authority to remain open during a declared public health emergency. You know, for the record, can someone please describe, or maybe public health is here, right? I think, okay, Laura Duenas is here. Director Duenas is still here, but for the record, can you describe the types of private businesses that have been directed to remain open under the current public health emergency and for which limited liability protections would be necessary? Dr. Kaneshiro, I'm sorry. You want me to repeat that again, Dr. Kaneshiro? I know I said Duenas, but since you've been answering the questions, do you need me to repeat that?
Please.
Okay. So Dr. Kaneshiro, on page 5 where it says essential business, that paragraph there, and just for the record, can you please describe the types of private businesses that have been directed, quote, directed to remain open under the current public health emergency and for which limited liability protections would be necessary?
You know, I have to think about that one. I couldn't tell you, actually. I mean, I couldn't tell you.
Okay, I know that this is going to be open for a while and people submitting, we're waiting for the AG's opinion on this. So appreciate it if some of these questions I ask, if you can answer them and submit that answer to myself as well as the oversight chair, I greatly appreciate it. Dr. Kaneshiro, there's a lawsuit filed by the private company against the government of Guam against public health. What is the status as to what the lawsuit is regarding this?
I couldn't tell you that either. I would have to investigate that.
No worries.
Sorry.
No
Sorry.
worries. If you, yeah, we have some time if you can talk about it. How about this, Dr. Kaneshiro? How about any related to the current public health emergency? What type of negligence claims / lawsuits have been filed against the government of Guam?
I couldn't tell you that either, Senator. Okay. I'm not really involved in those.
Okay. Well, thank you anyways for listening to that. And maybe if you can find out, that'd be very helpful.
Investigate for you. I will.
Oh, I appreciate it, Dr. Kaneshiro. Always a very helpful person you are. Thank you. I appreciate that. Thank you, Madam Chair. That's pretty much it with that. I had questions for the Attorney General, but hopefully we can get their testimony so we can read what they have to say about the law. Thank you so much.
Thank you. Yeah, normally I wait for legal review before we have the public hearings, but just because the term is coming to an end, I've been just this past week or two having public hearings even without those because, yeah, I've been waiting for a while. But anyways, I'm sure they will get it in before this bill gets to the floor. So next, Senator Kelly Marsh Sartino.
Therese Massey, Madam Chair. And, you know, as we go through this pandemic and these different hearings and just a lot of the processes, we're kind of all trying to find these balances between protecting the community, allowing for life to continue and so forth. And so I appreciate that we're continuing to look for finding a balance. And I too am really interested in hearing what the AG's opinion is going to be and the other testimony, so that I think one of the strongest factors here is what are the legal boundaries as to that can be striking this balance that we're trying to achieve. And so some of the issues that I hope the AG will just clarify is when there are statements about a business not being in compliance or being in gross negligence or willful misconduct, if that is going to be something that's determined legally in courts, if that's something that is certified or determined by the public health director. Yeah, so I'm just looking forward to a lot of what they would have to say, because whatever we put into place, we want to make sure that it meets its intention, it stands up in a court of law, and that it's as strong as possible and as clear as possible when we get it finally put together. So I just wanted to make those comments. I don't really have a question at this time. So just want to see, Madam Chair.
Thank you, Senator. Senator Muñoz.
Thank you very much, Madam Chair. Yeah, I was listening to some of the recommendations from Public Health, from Dr. Kaneshiro, and just kind of looking through the bill, and I'm wondering if maybe that language has already been included in there to, you know, to include the employees of Public Health. I'd like to read through it a little bit more.
We're back on after slight technical difficulties. So we lost our Zoom feed for a while there, but okay, we're back, and we will recognize Senator Muñoz on the bill.
Thank you very much, Madam Chair. And again, I was looking through the bill. I know that Public Health had some concerns about, or at least recommendations to incorporate their employees as well into this this bill to protect them from any liabilities. And just upon reading the bill through the bill, page 10, I was looking through item number 4 there. That might already incorporate the employees into this this liability. So yeah, maybe that's one thing that we can just point out to Public Health, that yes, it looks like we are already included in this bill to incorporate the employees there. So that's just one of the things I wanted to point out. And then just like, you know, everyone else, we're anxious and looking forward to the opportunity for the Attorney General's office to opine and give us some information and based on the bill. That's all of what I wanted to bring up. Thank you, Madam Chair.
Thank you very much, Senator Muñoz. So yeah, my questions were very similar to those that were already posed. And I know that, so the government currently waives liability for, you know, under the public health emergency statute. So this would expand that. And I appreciate, I think it's a good idea to expand where necessary This bill allows for public health to help make the determination as to which private entities are essential. And you and the governor are going to determine which are essential, which are going to be able to avail of this immunity. And but as to public health employees, I wanted to ask, does public health, have you received any guidance as to, for example, it was my understanding that, you know, public, if you're acting in your official capacities, you are already immune, but have you received any guidance that you might be liable for certain actions, like you said, putting people in quarantine?
It's just in case, I guess. I just want to say, just in case, because, you know, we've been doing a lot of public hearings. I mean, a lot of court cases with the people in quarantine, right? And so it's just so we can address that already.
All right, great. Yeah, perhaps the deputy directors here, I would suggest that you talk to the attorney general so that all your employees can be very clear, you know, that they are covered by the government's immunity statutes or not, as to which actions. And it looks like, unless it's gross negligence or, you know, intentional misconduct. Yeah, I'm not gonna suggest, but I think you should get legal advice. The other thing is that, one more thing I wanted to state was, oh yeah, so I was hoping that this bill is going to be able to cover, you know, people that can help public health, right? So they're not government entities, but they want to help you. For example, the volunteers that have want to come and assist in the tracing, or if, when we talked about in our oversight hearing about, you know, standing up all right, AV, are we still on?
I can hear.
Yes, we are.
I apologize for that. Yeah, I was just saying, I was hoping that this bill, I'm hoping that this bill will help address things like people helping public health, helping them in their tracing, for example, or even bigger, like when we're trying to take care of people in isolation. So if we want to set up additional care for those people in isolation. All right, I'm going to let you close on the bill, speaker.
I apologize, Madam Chair. I wanted to hear what he said. It froze a couple of times, but I guess in the efforts of supporting the recommendations, I also wanted to add that the suggestion that you made recommendation of that is something we can definitely add into the legislation, but also as it relates to the essential businesses, probably even as inserting the word on the essential businesses, and as far as the definition is after the word public health authority, it's a executive businesses, any private or public sector entity identified by executive order or directive from the public health authority allowed to remain open. So that would at least give the opportunity for those that remain open during the pandemic. But again, I just want to say I appreciate, Madam Chair, the opportunity for my colleagues who stayed on to listen to this bill, to public health. I know that Dr. Berg was trying to stay all the way through. Dr. Kaneshiro, thank you so very much. Tess, really, really appreciate the support. And again, just wanting to make sure that based on protecting and giving the opportunity for these businesses who do provide these services, that they be at least their minds will be at ease knowing that someone can't just come up and arbitrarily, take a suit against them. And I think that in the efforts of working closely with the business stakeholders that asked about this bill, I think that we can make it fair to even those that support the public health during this emergency. So very good. Thank you again, Madam Chair. I appreciate it. And I do hope that, and I can double check on the Attorney General's office and even legal working closely with you, Madam Chair, to see if we can get some comments from them that would help move this bill forward, if anything. So, Sainamasi, and thank you very much for allowing this bill to be heard. God bless.
Thank you, Speaker, and thank you again to everyone. There being no additional individuals to present testimony, the committee will consider this bill 414-35 duly heard. The time is now 4:30 p.m. and we are going to also end this hearing. And those who wish to submit additional testimony may do on any of the bills heard today may do so to the mail room at the Guam Legislature, Guam Congress Building, or through email at senatorterlajeguam@gmail.com. Times 4:31 p.m. Situs Masi again to my colleagues who were with us here and to the representatives from the Department of Public Health and Social Services. Your time is very valuable and we very much appreciate you being here. Take care, everyone.
Happy birthday. Happy birthday, Luis.